Thank you. Esther, you're already live. Please start. Esther, you're muted.
I've been speaking. I'm sorry.
Yeah.
Okay, ladies and gentlemen, distinguished guests, esteemed speakers, and delegates from across Africa and beyond, on behalf of the Africa Trauma Care Alliance, the nonprofit arm of the JAS Group, it is our great pleasure to welcome you to the third Africa Trauma Care Conference themed Bridging Gaps, Integrating Trauma Care into African Systems. We are honored to have you join us today, and we appreciate your commitment to improving trauma care on our continent. I am Esther Olainka Bello, and with me is Omolayo Yawoye. Um, I think she's having a bit of a network issue. But as we gather as a community of healthcare professionals, policymakers, and stakeholders united by a shared vision to provide accessible, equitable, and quality trauma care for all Africans. Over the next 2 days, we'll engage in thought provoking discussions, share best practices, and explore innovative solutions to address the complex challenges facing trauma care in Africa. Our conference program features an impressive lineup of keynote speakers, panel discussions, workshops, and case study presentations. We have brought together experts from diverse fields to share their insights and experiences. We encourage you to participate actively, ask questions, and share your perspectives in the chat. Your contribution will enrich our conversations and inform our collective efforts to advance trauma care. Before we begin, we would like to express our gratitude to our sponsors, partners, and supporters. Your generosity and commitment have made this conference possible. To our delegates, we thank you for your dedication to trauma care. Your work is vital, and we know this conference will inspire, educate, and equip you to make a meaningful impact in your field. So, right now, I invite you to get your water, find your nearest restroom, and keep your devices powered so you don't miss any part of this conference. Before we go on, I would like to practice with you some breathing to calm us down and get us ready for the session. So, right now, I'd like you to get seated comfortably and upright or stand, whichever you find more comfortable. So, what we're going to be doing right now is to breathe in for 5 seconds, hold for 6 seconds, and breathe slowly through your mouth, slightly open for 8 seconds. So, I will do it once and then you can practice by watching me as well. So, I'm going to do it now as you watch. So, try it one more time with me. I don't know how you felt, but that was very relaxing for me. Okay, I'm sure you feel relaxed enough to get into the session. Without further ado, it's our pleasure to declare the third Africa Trauma Care Conference officially open. Let's work together to build the gaps in trauma care and create a brighter future for Africa. I don't know if my colleague Omalayo is Ready now? Okay. Um, so I'll just stand in tissues till she's here. So for today, we'll be having sessions. First and foremost is our welcome address and introduction to the Africa Trauma Care Conference 2024, and the first keynote address titled Integrating Trauma Care in African Systems, the KADBUSA story. Then we'll take some time and we'll begin the first session of the conference. We will be starting with exploring the integration of trauma focused approaches into existing structures. Next, we'll have a session titled From Indigenous to Contemporary Counseling, Integrating Trauma Informed Approach into Counseling and Psychological Care in Africa. Then we have another session, questions, questions, questions. How the questions we ask impact our trauma work. Next up, we'll be addressing barriers to trauma care integration within the African context. We'll then have a self-care session on aromatherapy. I hope you're looking forward to that, which will usher us into our break and allows a short time for networking so you can also grab lunch. When we come back from our break, we'll move into the second part of the conference from today, which will be titled, we'll be addressing youth issues. And the first session, there will be youth and trauma, shaping the future of African trauma, African healthcare, sorry, followed by exploring techniques and avenues institutions can use for trauma care approaches to empower positive transformative societal change. Next, we have adverse childhood experiences, African cultural practices, and the psychological effects on the African youth. The last part of today's session will be a panel discussion on trauma, ACEs, and the youth in Africa, which you do not want to miss. And tomorrow, we'll be having a special presentation on the KADBUSA African approach to trauma care by Professor Merino and other insightful and exciting sessions to come. So stay tuned and don't miss any of these wonderful sessions to come. So right now, I invite the President, Jazz Group, leader of Africa Trauma Care Alliance, and the host and chairperson of the Africa Trauma Care Conference 2024 to give the opening remarks and our first keynote titled Cultural Dimensions of Trauma Recovery, an African Global Lens. First, I would like to introduce Dr. Akim Dotun Merino. She's a dedicated professor of psychology and a passionate advocate for modernizing mental health structures and reducing disparities. Her extensive career spans academic leadership roles, including being university president in Southern California. She has also contributed significantly to community agencies and hospitals. Currently, she serves as a mental health commissioner, overseeing services for 500,000 residents in the 4th District of Southern California. Professor Merino is the convener of the symposium and the driving force behind the Africa Trauma Care Alliance, both dedicated to trauma care integration, mental health advocacy, and research in Nigeria. Additionally, she's the CEO of Jazz Group and the president of Jazz Education Institute, where she provides trauma-based training to professionals, life coaches, and mental health providers. Professor Merino's contributions as an author and international keynote speaker, and her recent recognition as the 2021 Woman of Distinction by the California Assembly Legislature highlight her impactful career. She resides in California with her family. Please welcome with me for the opening remarks, Professor Akindotun Merino.
Hello, everyone. Hello, everyone. Welcome, welcome, welcome. Thank you for moderating this, Esther and Omalayo. We are so glad that to start this conference today. So wherever you are, I want you to introduce yourselves, put your name in the chat. Let's know what country you're from. But people watching from YouTube, we have those on LinkedIn, we have on Facebook. Everywhere you are, introduce yourself, invite your people, invite your friends, invite your tribe so that they do not miss this. All right, so this is our third annual African Trauma Care Conference. Honored colleagues, distinguished guests, fellow healers and friends, and students, I welcome you here today. We are gathered today on this continent that has witnessed both profound challenges and remarkable resilience. As I see all of you across all the portals that we're streaming from today, I see that we're not just mental health professionals, we're not just mental health specialists, we're not simply students or consumers, but we're guardians of hope. Each of you carry the sacred responsibility of healing in communities that have faced unprecedented challenges. Africa's story of trauma is unique. It is woven with threads of historical injustices, ongoing conflicts, and systemic challenges. But it is also a story of extraordinary strength, of communities that have developed sophisticated ways of healing together, of ancient wisdom that has always been understood that the spirit and the body heal as one. So today, we bring together two powerful streams of knowledge: the deep wisdom of our traditional healing practices passed down through generations. Africa has always known how to heal itself. And the latest advances in trauma care from across the globe. We come together at a crucial moment. Our continent faces the lingering effects of colonial trauma, the impact of ongoing conflicts and displacement, the strain on healthcare systems from recent global challenges, the effect of climate change on our communities, the particular burden carried by our young people. But we also bring with us the strength of our communal healing traditions, the power of our intergenerational wisdom, the innovation of African healthcare solutions, the resilience of our communities, the unwavering spirit of togetherness. We bring all of this together today and we still stand strong. So in the next 2 days, this today and tomorrow, we're going to share knowledge that bridges gaps. We're going to have professionals who are going to stand here and present papers. We'll have students who are still learning this trauma work, and they will also share their experiences. We're going to explore culturally responsive traditional trauma care methods. We'll develop strategies that work with our unique resources. Africa is unique by itself. And we're going to start building networks of support across borders. We'll create actionable plans for our diverse communities, that we have what it takes to heal ourselves. We have what it takes to be better. We have what it takes to restore. So let us acknowledge the weight of this work. As trauma care providers, we carry not only our clients' stories, but also our own. In this space, we commit to supporting each other as we support our communities. I always tell my students, you are the tool in the room. You have to be better. This is not wounded healing. No, it has to be the healed healing the wounded. So you have to do the work on yourself. So it is not just a story of our clients, but a story of us as the providers. This conference includes dedicated spaces for our own healing, for our own reflection. I want to speak directly to the experiences many of us share, to those who work in rural clinics, working with limited resources, to those who are bringing knowledge of ancient wisdoms and with modern challenges, to the students who are on campuses, who don't even know where to turn to when they're feeling not enough, when they're feeling that they don't know what to do with the depression or the anxiety or what it is that they're feeling, to the community health worker who are carrying the stories of their villages and of their towns, to the mental health professionals who are helping children rebuild their lives, to the medical doctors and the medical professionals who are working with limited resources. We are talking to you today. To the researcher who is documenting our unique healing journeys. These are your stories. And today we want to tell you that your work matters. Your experiences matter. Your healing matters. This conference is more than a gathering of professionals. It is a coming together of healers who understand the trauma care in Africa requires both global expertise that is deeply rooted in local wisdom. Every session, every conversation, every connection made here should serve one purpose: strengthening our ability to heal our communities while honoring their dignity and resilience. As we begin, I invite you to carry two questions with you. What wisdom do I bring that others need to hear? What learning can I take back to better serve my community? Let me say that again. What wisdom do I bring that others need to hear? What learning can I take back to better serve my community? Let us approach these 2 days together with open minds ready to learn, open hearts ready to support, open hands ready to work, open spirits ready to heal. The work of trauma healing in Africa is sacred work. I consider it a calling. It is a revolutionary work. It is a necessary work. And most importantly, it is a work that we must all do together. Welcome to this space of healing. Welcome to this space of learning. Welcome to this space of transformation. Let us begin together. I'm going to end with a prayer that Almighty God, we invite you into this space to flow with the Spirit. Let your Spirit move all through every space, every home, every sector on this our continent. Grant us peace, grant us light, grant us understanding, grant us transformation so that we can be better keepers of this place that you've given us. In your mighty name, amen. Thank you very much. I now invite the moderators to come back up, the MCs to come back up. That is Esther and Omolaya.
Mar, it's time for your paper presentation.
Okay, I guess I don't want to leave today. Okay, my paper presentation. All right, let me pull it up right quickly. Okay. I am glad to be here today to talk about this particular topic. As I pull it up, it's called Cultural Dimensions of Trauma Recovery, an African Global Lens. Cultural Dimensions of Trauma Recovery, an African Global Lens. This has been a labor of love. I have been writing this book for over 3 years. And this paper is a synopsis of what is in the book. So I will read this to you. There is a quote by Rumi. It says, "The wound is the place where the light enters you." The wound is the place where the light enters you. That's by Rumi. Kwame Nkrumah says, I am not African because I was born in Africa, but because Africa was born in me. I am not African because I was born in Africa. Well, because Africa was born in me. Desmond Tutu says this: no one can deny that there is a need for healing, healing of wounds inflicted, inflicted by inhumane acts, healing of divisions and discord, healing of spirits. This is why we're talking about the cultural dimension. I spent the first 21 years of my life in Lagos, Nigeria, and the next 3+ decades in the Sunshine State of California. If this were a biography, the duality of my experiences will make me particularly qualified to write this book. However, lived experiences cannot be undervalued either. In this preface, I will introduce myself through a trauma lens and then guide you through the labyrinth of the emotional and psychological trauma landscape in Africa. Our stories are waiting to be told and written. I hope that you will find your voice through this presentation today. My personal struggles and adversities have profoundly shaped my life, and I am reminded how deeply these experiences have informed my professional journey. This presentation is a testament to the resilience and strength that can emerge from understanding and addressing trauma. It is a call to recognize the power of our own narratives and to use them as tools for healing and transformation. My personal encounters with adverse childhood experiences, ACEs, were not mere fleeting moments of hardship. They were profound influences that molded my development and drastically reshaped my perception of this world, my reality, my worldview. These early experiences planted the seeds for my future path, a pathway that led me to pursue a career dedicated to understanding the human psyche, healing traumas, and teaching others to do the same. As an advocate, researcher, psychologist, and traumatic stress coach and professor of psychology, I have had the privilege of working globally with a diverse array of individuals, communities, organizations, and even nations. These roles have afforded me a unique vantage point from which to observe the universal nature of trauma and the resilience people are capable of summoning in the face of adversity. Through this work, I've come to understand that while trauma is pervasive and deeply impactful, it is not insurmountable. It is treatable, it is preventable, and it does not have to be a life sentence. Beneath the bustling skies of Lagos, Nigeria, my journey began at a school called St. Mary's Private School, where a perceptive teacher noticed my squints and struggles with my eyesight. And this led to the revelation that I needed glasses. All right. Until that moment, I had been navigating lessons and extra tutoring, striving to make sense of the blur before me, never daring to voice that my vision was impaired, which is something that happens to those of us who grew up on this continent. The culture of silence, where we don't say things, we don't say things that we're feeling, we don't want to rock the boat. The diagnosis unveiled long-sightedness intertwined with astigmatism. And soon I was wearing round-rimmed glasses, which became my constant companion. Oh, I hated those glasses. Even though I had clear sight, I hated those black frames. Feeling uglier with each wear, adding another drop to the well of my insecurities growing up. At the age of 10, like many African children, I was sent to a boarding school, the prestigious Queen's College Yaba Lagos, which my developmental years were shaped from the comfort, away from the comfort of home, where you're supposed to be with your parents for nurturing. We're all in this boarding space. People go to different boarding schools. People go to different places to get away. Sometimes it might even be prestigious to send our children away. But remember, those are developmental years for them that they're away from their parents. So formative years were deeply rooted in the Nigerian soil. And it wasn't until I set foot in the Western soil that I began to really discover who I was. In my homeland, various traumas, including environmental ones, had clouded a lot of potentials. However, once we arrive in a place that is nurturing, you begin to be a little bit more regulated. You begin to be a little bit more regulated in your autonomic nervous system. So you now begin to pursue academic and professional abilities. You begin to shine. The simple ways of swapping glasses with contact lenses, the simple way of being in a place where you are thinking about yourself a little bit more, gives you reprieve. And we can all find that reprieve somewhere. You don't have to travel to the West to find it. You can find it anywhere. You can find it just by maybe going to the beach, maybe going to your garden. Find a place where you can breathe again. He leads me beside still waters, and he restores my soul. Our souls are restored in still waters. Our souls are restored within still waters. It is important to know that there are experiences that we have experienced growing up on this soil that has shaped our lives. And that is why I am sharing these insights for you today, so that you can understand that I am a product of this soil. I am a product of this soil, and I know that there are things in this that the challenges here, but there are also different aspects of these places that can heal us. All right, this it's the family bonds. Is the concept of it takes a village to raise. It is the African sun. It is the African moonlight. It is the African stories. There's stories that are woven that can help us live better lives. The stories my grandmother used to tell me when we do alo alo, and she would start talking about all different things that happened. They're using stories to tell ancient wisdoms, to inspire us. That I want us to not only look at trauma care through the Western lenses anymore. I want us to begin to look at it from our own lens, from an African lens. That how do we heal ourselves? How do we get to the place where we begin to right wrongs in our own backyards, in our own communities? My struggles are your struggles. Your struggles are my struggles. These struggles and adversities will bring us to a place where we can start sharing our stories with others. We start sharing our stories. The power is being able to share your stories. Let's begin to own our stories. The stories of sexual assault, the stories of rape, the stories of brutalities, the stories, all of those horrible stories are not the only stories we have. We also have the stories of resiliency. We have the stories of never failing. We have the stories of being able to rebound. We have all of these stories. These are all stories that come together to make us who we are. That our own perceptions are not just shaped by what the West tells us to do. There's nothing wrong with the Western world. There's nothing wrong with learning. But we're saying that there is wisdom in this land. There is wisdom on this continent that we cannot bypass, that we need to stop and say that we honor those who have come before us, and we honor the legacy they've given to us. That this trauma work now, we're going to start looking at how did grandma heal themselves? How did great grandma bring the family together? Let's look at those as those gems of wisdom, and let's begin to incorporate them into our own healing. Thank you. All right. I invite Esther to come up. If you all don't come, I'll keep talking.
Thank you so much, ma'am.
Okay.
That was powerful. I don't know if you feel it right here, right there where you are. It was so powerful. Thank you, Professor Merino. And now for the second keynote speaker, Dr. Joseph O. Ike. Dr. Joseph O. Ike is the Director General of the Kaduna State Bureau of Substance Abuse Prevention and Treatment, KADBUSA. The agency has mandate to prevent and treatment of substance abuse, accreditation of facilities and organizations that handle substance abuse cases in Kaduna State, research on the incidence, spread, risk factors associated with mental, neurological, substance use disorders, as well as on mental health. Under his stewardship, the agency continues to champion policies and initiatives that promote access to evidence-based, community-based prevention, treatment, care, and support services for people with drug use disorders and mental ill health. He is a creative arts enthusiast and the founder and promoter of a number of creative endeavors in Kaduna State. To take us through integrating trauma care in African systems, the KADBUSA story, representing Dr. Joseph Ike, Dr. Omolara Ibinola.
Hello, everyone. Thank you, Omolayo, for that very wonderful introduction. Um, Hello, everyone. A very beautiful morning to you too, to you all. As introduced, I'm Dr. Omolara Ibinola. I'm the head of treatment services at the Kaduna State Bureau for Substance Abuse Prevention and Treatment. And I'm here to represent the Director General of the agency, who is unavoidably absent, Mr. Joseph O. Ike. Uh, I am currently at a program that KADBUSA has organized with the World Health Organization, and listening to Professor Marino just made me realize that this is just everything. What we're doing here, we're talking about arts in health, how to incorporate arts into health so that we find other ways to augment or support what we already do for mental health issues. So we're talking about everything about health promotion, storytelling, dancing. Our character as Africans, actually, we are artists already. See the way I'm dressed. You know, Professor Marino, you know that we exhibit, we create every day the color of what you choose to wear, how you choose to do your dress, how you choose to do your hair. Everything about us is art. So we're trying to incorporate that into healthcare to see how we can better the the health of humanity. So thank you very much. I'll quickly speak on the presentation, incorporating how to integrate healthcare into the already existing systems, and that is what we've done in KADBUSA. So I'll just quickly share my screen so that you're able to do that or able to see. Um, Kindly let me have a heads up if you can see the screen. Hi, Omolayo.
We can see your screen. We can see your screen. Doc, Dr. Molara, we can see your screen. Can you hear me?
Yeah, I can hear you.
Do we have your PowerPoint? If you send it to us, we can do it. Or you
Okay, all
can.
right.
I mean,
All
there is
right.
a. If you go where it says present, just on below you where it says present.
All right, so let me just go ahead so that I don't waste time. So at KADBUSA, the KADBUSA, as I said, it's the Kaduna State Bureau for Substance Abuse Prevention and Treatment, and it has the mandate. It was established in 2017 by law, and Kaduna State is still the only subnational with an agency dedicated to substance abuse and mental ill health issues. So it has the mandate to prevent mental ill health and drug abuse, to treat it, and also accreditation of existing structures that handle such issues. Research and of course mental health itself is is our fifth mandate. Um, so of course we know how much trauma is existing right now within our in our society, and in the context of Kaduna here, we have a lot of people that have been through so much that you would not even want to imagine. As a clinician, I could remember 2 years plus or so, there was no week at the clinic that I didn't have to review someone that had just been released, like by kidnappers, bandits, banditry, and all of that really ravaged the society at that time. So every day, every week in the clinic, you see at least one or two people who have suffered that they've been with kidnappers for 10 days, 2 weeks, some months. So traumatic stress, of course, can arise from various reasons, and that was really predominant in Kaduna here. Um, and of course, it impacts several personal functioning, interpersonal relationships, employment. Is associated with a variety of other psychological conditions: post traumatic stress disorder, anxiety, depression, somatization, dissociation, because the body really is the host of the soul, is the host of your being. So when it has been traumatized, then there is just a disconnect between the two beings. So this rising state of psychological issues in Kaduna State is what gave birth to the agency KADBUSA. And of course, at KADBUSA, what we did when we first came in is, okay, there are already existing structures that handle healthcare, health promotion. How do we leverage these systems to ensure that we deliver healthcare to the grassroots? I'm sure you would agree with me that one of the major issues about psychological, um, or let's say mental health care, is that it's usually just available at the top there, at the tertiary level, right? Because in 2018, we got the data that there were only about 250 psychiatrists in the whole of Nigeria, with a population of over 200 million. So all of those people only operate at the top right there. So there is nothing secondary, nothing primary. You only wait till your situation is that bad before you're taken to a federal neuropsychiatric hospital or a teaching hospital that has a psychiatric department. But we all know that these things start from the bottom. So that was the first thing we did in Kaduna. How do we stratify our healthcare here so as to reach the grassroots and so as to get to people before it gets bad, to nip it at the bud. So we stratified our management here into three. We have primary care, secondary care, and tertiary care. To deal with primary care, what we did was to leverage the already existing primary healthcare structures. Kaduna State has a huge landmass, 255 political wards. So 255 political wards. In each of those wards, we have a couple of primary healthcare facilities. Kaduna State has 1,062 PHCs. So we thought to say, why don't we just incorporate a mental health unit and a unit that deals with substance abuse through KADBUSA within the structure. The building is already there. All we need is an office. Also, these PHCs already have well developed integration with the community. A lot of them have what communities that they liaise with to pass information and all of that, and so we can leverage on that system as well. So that was the first thing we did. We were successfully able to develop 15 of those primary healthcare centers. So we have model primary healthcare centers around the state that have drop-in centers. We call them KADBUSA drop-in centers, where there are a range of services provided, up to 10 on the harm reduction package. So a person can just walk in, all the services there are free. A person can just walk in and they say they want to see a counselor, or they say, oh, I noticed my son is beginning to use cannabis, or is beginning to be unruly, and I would want someone to speak to the idea. And I would also want to take this opportunity to thank the Jazz Institute, because over 40 of staff of KADBUSA staff are currently undergoing the trauma stress care training also with Jazz Institute, to ensure that we're able to holistically look at clients, and just not about it's not just about substance abuse and mental health, but also to explore them deeply to their very first formative years, what they can remember, and explore what could be there that's triggering stuff in them. So that's what we have at the primary healthcare centers. You walk in, there's a shower in case you want to shower, or in case you've been in such bad shape, you've not been able to go home for days, and the people there have been trained to really care for the person. Just listen to people, and all of that. So that's what we've done on the primary healthcare level. We're hoping that we can scale that up, because centers for 15 centers for a population of over 10 million won't really suffice. So we have gone into agreement with the local government councils of the various local governments to see how you can support KADBUSA to employ volunteers, and we train them to see how they can get into the society and do more than what we've achieved. And so far, we're getting really good stories about what's the impact of the drop-in centers. Now, secondly, on this tertiary level, what we have we call community behavioral centers or community recovery centers. So we just opened the first one. The community behavioral center deals with cases that are a bit beyond what the drop-in centers at the primary level can deal with. So they are residential centers with up to 6 weeks stay. You're provided with feeding, you're provided a bed, you're provided with counselors, you have psychiatrists who come in, because Kaduna State is also lucky to have uh, one of the few federal neuropsychiatric hospitals here in Kaduna. The Federal Neuropsychiatric Hospital, Baranawa, is not far from the Community Behavioral Center, and we have an agreement with 3 psychiatrists there who regularly visit the center to ensure that everything is running smoothly. Um, so we also have been able to get another space. And I will tell you that KADBUSA as an agency doesn't really have much when it comes to funds. Finances have been an issue, so we've had to work on getting uh, leveraging actually what's already existing. So these centers were already existing, they were just not being used. We found one just not far from Zaria City is about 45 minutes drive from Kaduna Metropolis. So we found another place, and we wrote to the governor that we found this place and it's not being used. We want to convert it to a behavioral center, and he approved that. So what I would say is that Kaduna has been blessed with political will, because, or maybe it's just the way KADBUSA as an agency has been able to package its requests, that we're not asking you for money, we're not asking you to employ anyone, we just need you to give me this thing that you're not using, and that flies with the government, and that has been helping us. And at the tertiary level, we still rely on the Federal Neuropsychiatric Hospital to help us deal with issues that are beyond the secondary level. So when it's beyond that, because the psychiatrists that see our clients from the neuropsychiatric hospital, it's so easy for them to just refer and get someone to attend to them at the tertiary facility. So that's basically KADBUSA's story um, when it comes to how we've been able to do it, how we've been able to stratify it. But we're also very much um, trying to organize a lot of our projects around prevention. So we have a prevention department. The agency is broadly divided into three: the prevention department, the treatment department, and of course the Department of Admin and Finances. So the prevention department has a community-based prevention program, and they are using an evidence-based prevention program that was developed by the European Union in partnership with the United Nations Office on Drugs and Crime. It's called the Lulu program, and the Lulu program uses sports coaches. It's so fascinating to me. You just find a community sports coach, bring him to your agency, and train him for a couple of days on factual information about substance abuse and how to quickly identify that a child is traumatized or a child is not in their normal state of health, psychologically, physically. And you call them, how to converse and how to have that conversation with them, because it's easier for them to trust the coaches or their teachers than a stranger like me who is just coming to the community. And when you've gained their trust and you've been able to find out what the issue is, then you have access to us as an agency, and we can take it a step further and uh take their treatment or therapy a step further, right? So it's called the Lulu program, and it's currently existing in 15 communities in Kaduna State. So all those communities, we have a sports coach who has at least 12 young people. Some have girls, some have boys amongst them who play football maybe once, twice a week. And then when they come, they see the coach, they play football. The football also helps them distress and, helps them find a place outside home if things are not going well at home, that they can feel like a part of a community. So they do that. And also the sports coach have been well trained to help identify and refer if there is any issue or if they suspect that a child is not doing well. We Through that, we've been able to see clients who, we identified that, okay, we identified one not long ago that, okay, this person is suffering some abuse at home, and then we're able to step in. And what I would say here is that we've had to we've had to be we've engaged a lot of people, but we've really had to be very careful because the cultural context here is still northern and it's still a bit conservative. So we've had to be very careful in trying to ensure that confidentiality is maintained and the interest of the client is protected at all costs. So we have the Lulu program as a prevention program. We also have community-based prevention centers where people who are out of school can can come in and learn some vocational skills. So there they have carpentry and they have tailoring, and there are also people who have been trained in partnership with UNICEF to administer a program called Teaching at the Right Level, the TAL program, where you could just teach a 12-year-old numeric numeracy skills. It can just be 1 to 10 or alphabet A to Z, just so they're able to spell their names, even though they are 12. So you just meet them where they are and teach them what they can learn at that level while they learn a vocational skill to help sustain themselves. So we have that program too. And then we also just began the Alternative to Incarceration program in partnership with United Nations Office on Drugs and Crime. So the Alternative to Incarceration is in partnership with the Kaduna State Judiciary, and we had trainings with the High Court judges and the magistrates in helping to identify drug use and psychological issues in people that have come before their courts. So they are not to assess, to screen or assess. Even a suspicion is enough for us to invite us, and we do the screening and we do the assessment and we give recommendations. At the end of the day, the judge still takes the decision. He can say he's not going with our recommendation, or he could say he's agreeing with our recommendation. But ours is to give every individual a fighting chance, and then also this helps to decongest the our correctional institutions, and then helps to ensure that somebody who does not belong there but belongs in a hospital or belongs in a rehab is given a chance to go to rehab. And that has been an incredible program, because just last week one of the magistrate courts sent a referral, a 13-year-old girl that was caught stealing a phone, and she sold this phone for 500 naira. 500 naira is less than a dollar, way less than a dollar. And she was reported and taken to before him, and he said, like, she is so little and this crime is so this. I would I would want to hear what you have to say. And we screened and we assessed her, and we said it's not just stealing. She has some tendency, to defy instructions, and she doesn't recognize authority and all of that. So we will take her. We will manage her while we recommend some community service, because you also have to be wary of the person whose horse has been got, the person whose phone was stolen. The person has to feel that something was done to this person too. So some community service, she cleans parts of the courts once a week, and then she comes to our community center every other day, and that has been incredible. Was seeing that it's just been a week, but we're seeing that beginning to feel like she belongs somewhere, and that her situation is valid. um Also, we have a beautiful initiative around mental health, perinatal mental health. The perinatal mental health project, I nicknamed it the Rahama project. Rahama means blessing, in Hausa language, which is predominantly spoken here. So the Rahama project, the perinatal mental health project, looks at the mental health of women in and around delivery. So right before, during pregnancy, and up to 1,000 days after delivery, to see what could be there. So the project is just in its initial phases. We're doing a baseline survey first to know the predominance of perinatal mental health issues in Kaduna State. The global data is 20%. So 1 in 5 women who has gone through pregnancy and delivered, um, currently globally, suffers from one mental health issue or the other. It could be anxiety, postpartum depression, some postpartum psychosis. But we're doing that project here to see what is available, what the data is, and then the next phase of that is to train healthcare workers. Also, this data is not just captured in facilities, because over 70% of our women actually deliver at home. So there are community volunteers that work under with- work work with a lot of communities, and we're using them to reach these women who are at home to see what their issues could be. um, so after that, then the next phase of that will be training of healthcare workers, of course, to screen, and then to assess, to manage, do some brief intervention where they can, do some talk therapy where they can, and then send them to us if it's beyond that. What I would say is that the technical support here isn't so much. There are only a few technical staff within KADBUSA itself. That's why we're very grateful to Jazz Institute for the training that it has offered to KADBUSA staff. So we're having to use anyone that's interested. If you're interested, come, we'll train you so that you can help us reach someone else. Also, if there is already a health facility, we go through that rather than establishing a new one since the funds are not there. So we've also implemented the harm reduction program, as I said, in our drop-in centers. So the harm reduction program, aside from the screening for HIV, STDs, there's also the family and individual counseling. And through this family counseling, we're able to see beyond what the client is telling us. We're able to perceive other things in the family, because if someone has come to you with an issue or around dependence on some drugs, because we can't really separate the two here in our context in Kaduna. A lot of the people who cause trauma, a lot of the people who cause trauma here have been reported to be under the influence of something. So it's very easy for you to just merge the two and screen, and you would likely find both through trauma and substance use. um, so we've had to just merge the two, substance abuse and mental health, so that we're able to holistically manage people. So that's basically what our response has been. Our principle here in Kaduna has always been build a network of trauma care specialists and use existing healthcare structures. We focus a lot on capacity building over the last year. We have just been from school to school to school, trying to build capacity of the staff we have, of our volunteers, and to strengthen referral pathways. The 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 current agreement or the current understanding we have with the Federal Neuropsychiatric Hospital has really helped us reach a lot of people and to help manage their issues when it's beyond the secondary level. We've also had a lot of multi-sectoral approach that is using our partners, United Nations Office on Drugs and Crime, has been very helpful. And there are partners in and around Kaduna that work around this same mandate. So we've had to collaborate with them. And we're hoping that in the future we can work on policies that will help guide, that will set principles and guidelines that will be followed and will constitute institutional memory regardless of you know whether we as humans as individuals are here or not. It will outlive us. So that's basically it. We've tried to measure the impact of what we've done over the last couple of years, and we've seen the importance of data collection, of monitoring and evaluation, and building sustainable projects. So our current or unique challenges as a state or as an agency in a northern state, I would say, are cultural gates. There is a there is a there is an unsaid or unwritten law, the unwritten law of kunya. We call it kunya here. Kunya means shyness or modesty. That is what is that is what people call it here. So this kunya is what stops a lot of people from speaking their minds or on expressing themselves when they feel hurt. So when your parents have done something to you, you're not to talk back, you're not to tell them how exactly you feel, because then you do not have kunya. So we're hoping that in the future, with advocacy and with trainings and sensitizations, that this is less, so that people are able to speak up, because when you speak up, you're better able to express yourself, and you're even better able to reason through your thoughts when you speak about something to someone you trust. Also, I mentioned earlier the poor health seeking behavior. You really have to go home to meet some of your clients. They won't come. We have some we have principles and we have some rules with our clients that have enrolled, but before they enroll, you really have to go home and speak to them and get them to come, because getting them to come to the office is part of what constitutes commitment. So that's basically it. Thank you so much for your time, and thank you for listening. And I hope this helped someone, or someone this would help someone replicate this in another state, because that's just what we've tried to do. So thank you very much.
Thank you so much, Dr. Molara. That was really, really, really insightful. We appreciate you. And thank you to Dr. Joseph
Yeah,
for sending you here to present this to us. This was really, really, really good. Kaduna is doing very well. Thank you so much.
thank you.
Okay, I'm sure we all heard that, and there's more to come. Right now, we'll be listening to two current students of the Jazz Traumatic Stress Institute. They will be sharing their success stories of trauma care in their sphere. So I'll be inviting Ehi Ojalabi and Lola Shagbale to share their experiences.
Good morning, ladies and gentlemen. Standing on existing protocol, just go ahead and do a quick introduction of ourselves with me. I have Lord Damilola Samuel Sapale and myself. We're both from the Enable Wellness Foundation, where I happen to be the founder and convener of this amazing community. We are currently students of the Jazz Institute undergoing integrated trauma care training as coaches, as trauma care coaches. And it's been amazing, to say the least. We can begin to talk from our personal experiences. And at the time when Enable Wellness was set up, it was set up with the heart to, it's a non-profit organization. And so we set up to support people, especially women, Nigerians, Africans, find lasting freedom from the habits and addictions, trauma, that they can cope with the day-to-day stresses of life and hopefully thrive through life. And we set up a center.
Hello.
At the time,
Okay.
Go ahead. Go ahead.
at the time, oh, thank you. I can hear an echo, so I'm wondering where it's coming from.
I think we just need to mute someone, but you can go ahead. I'll work on that.
Okay, thank you. At the time we set up the the center, we called it a wellness center, and we called it so. And we knew it would go in 3 phases. First phase, knowing that we do not have the power to save anyone, and so we're obviously directing them to a higher power. And as a woman of faith, it was to point them to God. It still is. And so that's the first stage, that we're directing them to God, recognizing that they can get saved. And then the second phase being that we will be able to give them the therapy that they need. Some of these ladies going through abused, sexually assaulted, dejected, traumatized. A lot of them already into drugs. And so we knew that at some point we would need to give them the psychiatric care that they would need, and ultimately skill acquisition. So we put it in those 3 brackets. Still confused on how to go about getting all that care and support. Jazz Institute came to light. And Jazz Institute has been our miracle as a foundation, literally just speaking. I'm almost in tears now saying that, because of the intervention that we've been able to get by just connecting with the Institute and just getting that exposure and recognizing what trauma really is all about and how we can intervene in the society with the knowledge. We put in the first set of 2 people in training, including myself. Came out of that and we realized we then had tools to support the ladies on the street. Mandate being for us, to get the ladies off the street. We go to the brothels, as far as to the brothels. We go to speak to the ladies who stand on the streets on a Friday night, on a Saturday night. We do interventions in secondary schools, speaking to the ladies and the all-girls schools, and exposing them to the dangers and what could be, and just how they can help themselves and get the help that they need. And so when we put the first set of 2 people through trauma, it was amazing. The amount of support we got from the Jazz Institute, the amount of help we got, the tools that we got out of there. We had the first trauma client go through 12 weeks of free trauma care. And that lady came out, oh my days, from the abandonment, from the childhood trauma where she had experienced abandonment, molestation, rape, to the wrong decisions here that had taken her through life, to eventually getting care, trauma care. She came out of that training and she looked at me and said, "You're the best thing that has ever happened to me." And I knew exactly what she was talking about. It was the trauma, it was the care the tools that she had received. She had started to see changes in her life. She had started to see herself literally transform. She had become gone from that isolated lady, from that dissociated lady, to being able to connect with her community, connect with her job, connect with her environment, to being able to speak up and literally just see that lady glow over the weeks, come out of herself over the weeks. It's such I cannot find the expression to give to that sort of help. And I mean, we now go into the street. So currently we have another 5 sets, including myself, because I've gone back to class again to say, hey, there's more to this, there's more to learn. And the knowledge for us has been our biggest tool. Knowledge is power. The intervention that we've been able to give in the society has been tremendous. With 5 of us in the class at the moment undergoing integrated trauma care coaching. And between us, we have 8 clients. Most of these clients we have met on the streets. We met a lady, let me just use this opportunity to say special thank you to Dr. Marino. You do not realize how far this has gone, the impact and the generations that you have impacted by just training, by just deciding on doing this as an institute. We met a lady on the street a few weeks ago, and we were able to sort of intervene and give the first. So for us, trauma care has become that first aid, and we're able to begin to speak to them, first of all, to help them on the spot, to bring them in and to draw them in, to say there's help, there's care that you can get. And as we started to speak to this lady, I find that this lady has 3 children. And so between us being able to get that lady off the street of prostitution, we have been able to not just save that one lady, we have been able to save 2 generations. 2 generations, including her 3 children, who she would lock up in the house and come out every night to try to get money. Broken, dejected, abused. All she needed was support. All she needed was the care, was the tool to say, hey, you can heal. That's what you need, heal. Thank you is not enough to what Jazz Institute is doing. But it goes a long way. And this is just the start for us. We have over 60 ladies connected with the foundation. And so this is just the start to how far we can reach. We've set up the first center now that we have now been, with proper understanding, we're able to say this is a trauma care center. And we've opened that up to the people in Rivers State where we are at the moment. We have people undergoing training in, Jennifer is listening, in Benin City, in Nigeria. We have people in Lagos, Kakars in Lagos. We have 4 of us here in, that's more than that. Was 6 of us here in Port Harcourt, Rivers State. And that's how far-reaching. And so we're looking to hopefully set up trauma care centers all across Nigeria, all across Africa, as we're able to reach and build a network of trauma care experts. And Jazz Institute has given us the opportunity to do so, to build all across Nigeria, to build all across Africa, to be able to encourage and help people get the right trauma care that they need, that we can see less ladies on the street because they're equipped to cope better. I can go on and on and on and on, because this is really our passion, to be able to help women achieve self-actualization, to be able to walk in wholeness, to find themselves, and to build their lives all over again. And so this is a really helpful tool for us as we create channels to heal and add value to this society. Thank you. Samuel, you want to add to this? Samuel, you're
You're
muted.
muted, Samuel.
Yeah.
Oh, can you hear me now?
Yes, we can.
Okay, so the first time I volunteered was in the university. I think my 300 level. I was with another group then called Grassroots Foundation. Our goal then was to help the less privileged children in society to be able to catch up or to be able to fend for themselves, make something out of their life by empower them with tech skills. That was the goal then. But in the course of that journey, I now began to realize that, hey, there are other things going on here beyond just going to empower people, beyond just going to train people on different tech skills. Because when we went to, usually we went to slums and orphanage homes, then those were our main targets. But upon getting there, you now realize that these people are at different levels. Some of them are even educated. Some of them are in the universities. Some of them are, they did not have any form of education at all. And the truth is, at that time, that the goal was, if we did not meet these people now, in the next 10, 20 years, these people would have produced another set of people. And that's supposed, is it misnormal state or condition or situation would have affected the next generation. That was just it then. Then for the ones we could work with, we worked with them. For the computer labs we set up, different labs anyway, mainly computer labs, we could. But right there and then I now realized that, okay, we've done this for these people now. Will it work? For some, we had success stories, but some, they had other issues bigger than just wanting to fend for themselves. They could not function properly because some of them were under the influence of drugs. They had addictions, different kinds of addictions. Some of them were in very pretty bad states. Let me just leave it at that. Upon finishing from in the university, I was posted to Port Harcourt, and I think about 4 months till my POP, I met Enable Honest Foundation. Because at that point, I knew that, okay, I want to stay in Port Harcourt after service, but I did not really know what to do or where to go then. And I knew that, oh, once I finish with this organization, I think then I was a I was an executive in NCCF, even as a copper. I knew that after that, yes, I'll face my professional career, but I still have to do something for humanity, just simply put. And Ma came at that time. She casted the vision. I did not understand it fully, I will not lie, but I was interested. I was like, yes, this is it. And I jumped at the call. We started for over a year, and then I began to realize how my experience in the previous organization I worked with, as a volunteer organization, is, if though it's important here, but it's not as relevant because what we are facing here is quite different. That's true. And majorly here, we are not dealing more with children, though we have children also that we meet on the streets, but we are dealing more with females, to be precise, and we are dealing more with a lot of co-occurring challenges. Aside the fact that they had their own problems, they also had other issues that were co-occurring. And I think one big light that came was the me being enrolled for this course, because it has opened my eyes to see that, okay, this is how I can help. This is what I can do. Okay, this is what is happening here. This is who to call. That's in cases that I'm not equipped. I'm not, how do I put it now? In the cases that I'm not qualified to handle, I can recognize specific professions that, okay, you can come in here, you can come in here, of which I did not before because I come from an engineering background, so to say. So I think I must say thank you for this opportunity, ma. I want to say thank you to Professor Merino also and Jazz Institute. Thank you. That's all from me.
Thank you so much. That was so, so, so good. We appreciate the work you're doing. And Samuel. Thank you so much for sharing your story with us. And we do hope that you continue to make the impact in your communities and everywhere you go. So thank you.
Thank you.
So moving on, right now, we'll be having the next speaker, Mrs. Grace Alexander. She will be exploring the integration of trauma-focused approaches into existing structures. Mrs. Grace Alexander is a dedicated advocate for individuals in the with disabilities in the UK and in Africa. With degrees in English language and education from the University of Ife, Nigeria, as well as qualifications in social work from Metropolitan University, London, she has built a career as a compassionate champion for disability rights and social inclusion. Um, Grace is the founder and CEO of the Star Children Development Initiative, an organization that provides support, awareness, and education to parents of children with special education needs and disabilities. Drawing on her personal experience as a parent of a child with special education needs and disabilities, she established SCDI to raise awareness about disability issues and advocate for the rights of disabled children. Grace also co-founded Every Women Masters UK Summit, a non-profit organization addressing development issues for girls, women, youth, and individuals with disabilities in both the UK and Africa. She believes in the power of collaboration to empower individuals with disabilities and has worked with numerous organizations in the UK and Nigeria to combat discrimination and stigma globally. She has received numerous awards for her advocacy, including the Acne 100 Women Award in 2019 for her contributions to disability issues in Hackney, UK. She is also a trauma-informed care specialist and a strength factory coach, and she is committed to the principles of equality and social justice for all. Grace is happily married. Welcome, Mrs. Grace Alexander.
Oh, hello, how are you? Thank you for that introduction.
Very fine.
Thank you
Good to
so
have you
much.
on here, ma.
Yeah, thank
You're
you. And
welcome,
I want
ma'am.
to actually thank the Jazz Educational for actually convening this event. It's about time for us to have a fulfilling life, for us to be self-aware. We need this trauma care training. So thank you very much, Professor Merino, for making meaning of my journey of parenting my young man who will be 30 next year as a proud mother of a young man with disability. So I want to say thank you very much. Okay, going to my topic, which is exploring integration of trauma-focused approaches into existing structures. So we are going to explore two things here, or three. The main objective of this paper is to explore a comprehensive approach to trauma-informed care in corporate settings and how it can be adopted into existing corporate structures, particularly persons with disabilities across corporate organizations. And then again, it's also to explore the role of leaders in corporate organization in driving a psychological safe place for every employee, irrespective of their disabilities, with the aim of promoting a culture of trust where everybody is valued, listened, and respected. So for us to actually, I mean, it doesn't matter whether you are disabled, everybody has to have a sense of well-being. And now there cannot be any inclusion without well-being. I mean, in every organization now, well-being is now incorporated into corporate policies, systems, and policies. So it's important that every every employee has every employee is able to work in an environment that is not toxic, in an environment that is free of where you are not being valued. And especially we can know that people with disability, because that's my area, that's my passion as a mother and dealing with other people with disability, there is a lot of, our system is actually, and the social construct is actually riddled with a lot of discrimination, marginalization of persons with disability. Globally, we have 15% of world's population that experience some forms of disability, according to the World Health Organization. And in Nigeria, we have almost about close to 29 million of persons living with disability. And one of the things is that within any organization, there are a lot of things that can create an unwelcoming environment for persons with disability, such as microaggression is there, where people just say some things about you. And before we go to disability, I would like to mention, next slide, please. What is disability? Disability is defined as a condition or function judged to be significantly impaired relative to the usual standard. In other words, the term is used to is used to refer to individual functioning, including physical impairment, sensory impairment, cognitive impairment, intellectual impairment, mental illness, and various types of chronic diseases. And the next slide, types of disabilities. We have physical, I mentioned that we have physical, we have, and then let me tell you, there are some disabilities that are not visual, that you can't see them. They are called neurodiversity. They are part of what you call, they are called people that are neurodivergent, who are not. These are people with autism spectrum. These are some people with epilepsy. Some of them you might not know until that thing is actually happened to them. And we have people that are Tourette syndrome. We have people that people are on the spectrum of attention deficit disorder, that is ADHD. We have people that are dyslexic. So we have all that in people that you can't see. Even deaf people, they are all under the spectrum of hidden disability, because until they talk, you can't, until you ask them something and they can't respond. Or somebody that is deaf, or somebody cannot speak. So we have different types. So there are so many myths and misconceptions which are called social constructs, or that are associated with disability. Some of them, they said, oh, they are not they can, or that they are not, they cannot work, they are not productive. And you'll be amazed that globally, persons with disability are the most creative. They are the most creative and they're the most innovative. We have different people who are with disabilities and they are doing amazing things. Like, for instance, the person that's owned Virgin is dyslexic. Steve Wonder is a musician. And other people, Bill Gates is dyslexic. He dropped out of university. So we have a lot of them. And people just judge, they don't see them as a whole person, which is why when it comes to corporate settings, they are not actually part of the people. They see their disability, they don't see them as a whole person. So as a result, they feel isolated, they feel disconnected within their environment. And as a leader, it's high time we start making sure that persons with disability are seen as a whole person, and their wellness, everybody wellness, no matter how complex your disability, everybody is a human being, irrespective of your disability, and everybody has abilities. So now we go to the next slide, please. What is trauma-informed approach? Trauma-informed, I'm sorry, because one thing is that when you live with disability, there is an intersection the mental health or trauma and disability that I went through. It was a traumatic experience raising my last son, who will be 30. I felt like anxieties, panic attack. No, I was like shaking, and it was like, and in a system where you are bringing a child in an environment where they are not recognized, where their well-being is not, they don't count their well-being. And when they start working, you can realize that if a leader is not really, because part of the work of a leader, of an inclusive leader, is to influence. If they are not able to take everybody together, there is no way they can achieve productivity. There is no way they can achieve, they can actually tap into everybody's talents. So it's everybody is a human being, irrespective. So what I'm saying, so what is trauma-informed approach? Trauma care-informed approach is a health and care approach that acknowledges the impact of trauma on people's lives and aims to improve their outcomes. So if somebody is having some traumatic issues, or the environment is where microaggressions persist because they have disability, obviously those environments, those people working in that environment, they will not thrive. They will not thrive. They will not be the best version of themselves. And that's the role of a leader, to bring the best. A leader is not the one that has the solution for everything. That's a fact. A leader must be able to encourage every member of his team to be the best version of themselves. And that means it has to be an environment that is inclusive, an environment where everybody is valued, an environment where everybody is respected, an environment where everybody has that voice, an environment where every opinion counts. That is very, very important. So, and this trauma-informed care approach seeks to understand the impact of trauma and build the path to recovery. That's why this approach is very important. And it lets us understand the signs and symptoms in people. And so the knowledge of this should be drafted into companies' policies, procedures, and practices. So it's about seeing everybody as a whole person, like I said, in a workplace without bias. So your speculation, your assumption is not, or your perception of an individual is not the reality of that person. So everybody must be heard, irrespective of their disability. So the next one is the next slide, please. The next slide, please. So now the principles of trauma-informed care. The first one is safety. This prioritizes the physical, psychological, and emotional safety of service users and staff. So a workplace should be able to be a psychological for every staff, where they can flourish. So safety is one of the principles. Then trust. How does a leader promote that trust? That trust indicating the culture of trust into companies' transparent policies and procedures. That means they must be transparent. And then cultural consideration. So you are not, moving from past cultural stereotypes and biases associated with person with disability. Everybody is a human being. Everybody has capacity to learn. And when an environment is an environment that is not toxic, everybody will be able to thrive. And that's the role of a leader. So also, this can also be achieved by ensuring that team members know that they can seek help. So every leader must be approachable. And there's no way if you have a team of different people, because one thing we have to realize that we come from different backgrounds. So many things have informed our reality. So many things have informed who we are today. So that is why they have to make sure that everybody seek help or clarification without fear of judgment. So a leader must be very judgmental, must be non-judgmental. So leaders must promote independence, self-confidence, and psychological safety of persons with disability in a workplace. Then humility, and that's part of being humility, being able to listen without judgment. And one of the critical things is that you, irrespective of what that person is saying, you should be able to listen, because when you listen, it brings collaboration. It shows that the person is valued. If person has a voice, then it will create the person will be able to have a voice within the organization. So, and no side talks of microaggression. Microaggression is when you say, "Oh, like people from my place." You can see how he works. So they can actually feel when an environment is really toxic, and when they is toxic, they cannot really function. So next slide, please. How can trauma-informed care be applied? So one, asking questions about their support needs. One of the things is that when you employ or when you want to do an interview, it's okay to do a kind of survey. How do we support you so that you can do your work very well? And this, when you do that, this encourage trusting relationship. So, and the manager must respond with passion. So self-compassion is there. And that's where another way you can provide a psychological safe environment which is crucial for team performance for your team members. So the challenge, hello, okay. So this is a crucial team, okay. They are more likely to express their ideas, voice their concerns, and take risk without being judged. That means they will be more innovative. They will be more creative about their ideas. And this means working together in a safe and compassionate environment where all, irrespective of that, can thrive so that they can bring the best potential in them. Next slide, please. So the challenge we have now is that the great challenge over the next decade, and I think is the tension between outwardly pushing for an inclusive and accessible future for millions of people with disabilities while dealing with the psychological impact of collective and individual shame that has been passed on from generation to generation. So when a disabled person is working anywhere, it's always better to actually hear their voice. Don't judge them with that government. Support them. Empathy is one of the greatest. Another way we can show. Next slide, please. We can create a psychological safe place for everybody that is there. I don't know whether you can see this. I can't. It's so small. It's so small. These are things that they go through: isolation, withdrawal, shame, guilt. And the next slide, please. Next slide. So, steps of becoming a trauma-informed organization. One of the steps is One of the steps is building awareness and generating buy-in for the trauma-informed approach, supporting a culture of staff wellness. I told you before now that there cannot be an inclusion and there cannot be a psychological safe place if they don't inculcate a culture of staff wellness. That is very, very, very important. If not, the benefits of promoting wellness in a workplace for everybody, irrespective of their disability, they are so massive. One of them is that it boosts, you can be able to take risk. One, then two, you'll be innovative because you'll be amazed what ideas people with disabilities can bring, or anybody within the team can bring. They are very creative of ideas, innovations they can bring, and you can try them, and they will boost the performance and the success of that organization. And then hiring a workforce that embodies the value of trauma-informed care. That is very important when you want to support a culture of staff wellness. Then, and the third one is creating a safe physical, social, and emotional environment. One of the things is the emotional intelligence of everybody, especially what is your emotional saying? Acknowledge your emotion, discuss with, when you are in a place of work, your team members are your support system, are your network. How are you supporting the wellness of one another in a workplace where you can force it? And this, when you do this, you will encourage active participation from every member of the team. No one is isolated, no one is muted, because they know that they don't want to listen to her or him. They will feel muted, they will just be muted, and they will not be able to contribute. They will isolate. And it's okay to ask anybody. If you see somebody is just unusually quiet, is everything okay? It's okay to ask after one another. It's very, very good. And that means you can foster an environment where everybody feels heard and respected. So when individuals feel that they are more likely psychologically safe, they will contribute more, They will engage more, and this is providing psychological safe place is very crucial for staff engagement too. Without that, they cannot, you can't see, and it's better. Diversity is fun. And another one is that appreciating the differences in every human being. We have different perspectives which can be useful. Let's listen to one. Next slide, please. So we have to be pushing for inclusive and accessible future for millions of people with disability while dealing with the psychological impact of everyone, so that we don't start passing them from one generation to another generation or generation in centuries to come. So creating an inclusive environment where everybody can thrive. And one of the things I want to mention is also making sure that you embrace neurodiversity. That means you see people with disability beyond their medical condition, recognizing them as a whole person. That is very, very key, and that is very important. Next slide, please. Next slide. Next slide. Okay, so I'm telling you now, thank you everybody for listening. And I want to tell you that I'm a proud mother of one. You don't judge the book by its cover. They know more than what you think. You'll be amazed. My son will be 30, and I've learned so much from him. And I've dealt with people with disability in United Kingdom and in Africa, and you will be amazed what they can put on the table. So it's high time we recognize them, and it's high time we promote staff wellness, irrespective of their disability in a workplace. Thank you very much.
Thank you so much. Thank you so much, Mrs. Alexander, for that insightful and eye-opening presentation. I'm sure that everybody listening and watching now have been challenged to do the needful. Thank you so much. Next, we have Dr. Nayet, who will be speaking on From Indigenous to Contemporary Counseling, Integrating Trauma-Informed Approach into Counseling and Psychological Care in Africa. Dr. Nyemedi Agotso Edotoga, PhD, is a Ghanaian licensed counseling psychologist with over 16 years of experience in counseling psychology within educational institutions.
Let me interrupt you. Dr. Nayet is in here. Right. Let's go to the next speaker, please. Thank you.
Esther, over to you, please. You're muted.
Sorry about that. Yes, I was saying next we have Miss Fumi Johnson, who will be taking us through questions, how the questions we ask impact our trauma work. Ms. Fumi Johnson is a qualified coach and counselor who has been working with women overcoming the trauma of domestic abuse since 2011. Her skills and extensive world travel mean that she can coach on a wide range of issues. Her coaching style helps women to identify, clarify, and tackle the issues they are facing. The benefits of being coached by Fumi include increased self-awareness and self-confidence, which in turn enable you to acquire the tools needed to make positive changes in your life. Fumi is an avid reader who draws extensively from writings in the coaching, leadership, and psychology fields to inform and improve our practice. Fumi holds a certificate in coaching from the OCM and successfully completed a trauma-informed care certification course. Welcome, Miss Fumi Johnson. Miss Fumi Johnson, are you there? Okay, we can't see or hear you if you can hear us.
I'm sorry. I stepped away from my desk briefly.
Okay, over to you, ma'am. You have the floor.
Right. Thank you so much for the invitation. It's been an interesting morning so far, and I hope that the diverse information, diverse bits of information that we've heard regarding trauma informed care, trauma, how it impacts people is really sinking in and is going to make a difference to how you practice, how you view things. So I am Fumi Johnson. I'm a trauma informed coach. Um, I can't say that it was planned. I think I sort of in COVID times I was thinking, well, I'm going to use this time to be productive and learn new things. And at the time, I thought to myself, yeah, trauma informed care sounds interesting, and that was how I began the journey. But I have to say that it's really made a difference in how I practice as a coach. It's really given me new insight as to what it means to work with people in a trauma informed way. So I was kind of thinking to myself, well, you know, how do I start this talk? How am I going to introduce how I got into this talk? And I realized that I had two memories from childhood that really sort of linked how I think about this and what I think about how I'm going to talk about today. So the first memory is of being about maybe 4 or 5 and going to the library. I distinctly remember sort of as a small person sort of going along with my classmates, and we were going to the library, and I remember feeling so excited about going to the library. I remember that excitement of being able to check books out and take books home and just disappear into another world as a result of the books I was reading. So that's the first one, love of reading. And the second one is, and I have to apologize to my mum here because being a mum myself now, I realize how it must have been. My second memory is that I was a very, very, very curious child. I expect now that I probably came out of the womb asking why. Why have I been taken out of the place I'm familiar with? Why am I in this new place now? My favorite question was literally why? Why? And I remember my parents saying to me, you can find the answer to every question you have in a book. And they bought me encyclopedias. And I spent many an afternoon, many a day, sort of with my nose buried in an encyclopedia, finding out random bits of information. So that leads me to my talk today about questions. Questions, and how the questions we ask impact our trauma work. So I'm really speaking to people on the front line. I was very impressed by Ehi's description of what they're doing, that frontline work. And really for other trauma-informed coaches like myself, you know, we ask questions, you know, as a recovering lawyer and a life coach, questions are my thing. You know, I could ask questions until the cows come home. In fact, sometimes my siblings say to me, stop interrogating us. And I'm like, I'm not interrogating, I'm just asking questions. And, you know, something for you to ponder, or I'm sure you already know the answer. Why do we ask questions? Because we want information. You know, sometimes we're being nosy, going to accept that, going to admit that. Sometimes it's like we're CIA or FBI, you know, what happened? Why did it happen? When did it happen? What did you think? We're asking those questions because we want information, because we want to learn something. Mostly, I think that's why most of us ask questions. We want to learn something. There's something we don't know, and we want to know it. And so asking questions is really done well. It's a way of gathering information, but not just gathering information for information's sake. It's because we want to learn something. Hopefully, we want to learn something. Because as the last speaker said, you know, prejudice, discrimination, preconceptions about people are rife. And so rather than just assume that we know what is going on for somebody, that we know you know, what should be done, we should ask questions. We should get into the habit of asking questions.
different types of questions, open questions. I remember when my daughter reminded me of the five W's and an H: what, when, who, why, where, and then how. And I think she was taught that structure in terms of when she was writing an essay or answering a question, she should follow that format. And I found it really useful. I thought to myself, that's a good reminder of, asking questions in a helpful way, asking questions to get the most information. And if you generally approach asking questions in that way, you're going to get as much information as you need. And that's important to us as trauma-informed coaches, because when somebody is sitting in front of us, we're not just seeing them as they are now, we're seeing every iteration of them. They may not know exactly why they've come, but we should always be cognizant of the fact that we are seeing every iteration of them. And if we don't ask the right questions, if we don't get the information we need to have, we're not going to be able to serve them in any meaningful way. So those questions. But just a caveat about the why question. That's the one that most of us go to as a default. Why? On the surface, it sounds like it's not a big deal. It's a question. Why shouldn't we ask that question? And I would say we need to use that why question sparingly, because the tendency is, if you ask the why question, the tendency is to put people on the defensive. If someone comes to us and we say, why are you here? It doesn't matter that we're just trying to open the conversation or we're just trying to get a sense of what brings them. It puts them on the defensive. One, because they think, well, if I knew what was wrong with me, I wouldn't come here. I would be able to deal with it myself. And sometimes people can hear a little bit of judgment in that why question. So as a general rule, I try to use the why question quite sparingly. I prefer what, when, who, where, how. Those kind of questions I find open the conversation more than the why question. Not to say that you would never ask the why question. Sometimes you will. Sometimes it's very, very necessary to ask the why question. But think about what the impact might be when you ask that why question. So, like I said, different types of questions. Closed questions, as the name suggests, that's going to close everything down. A closed question is like, it doesn't leave you with many options. If I say to you, the weather's not very nice today, you've only got one option. It's either yes or no. It doesn't lead you anywhere. But if I say, what's the weather like today? There's room for you to describe it. There's room for you to give me your own interpretation of what the weather is like today. Probing questions, those are questions that help us to go deeper. And as trauma-informed life coaches, like I said, we're not just seeing the person who's sitting in front of us right now. We are seeing every iteration of them. So when we ask probing questions, we're trying to dig deeper. We're trying to deepen that conversation between us. Rhetorical questions are just, they don't really demand an answer, but they're useful because sometimes they allow a person to reflect on what they've said to you. And asking that rhetorical question, again, can open up a whole new level of exploration. So when I was thinking about the questions, my top 3 questions in terms of trauma and things like that, I sort of was pondering it and thinking, what's going to happen? But the first thing is to recognize that trauma, when we say people are broken, it's a very heavy thing to say that a person is broken. Personally, I prefer to say that a person is not broken, but that they are just bruised. That they are bruised from the experience and effects of trauma. Trauma has, if you think about people as having a particular shape, trauma changes the shape of who they are. The experiences, the effects of trauma changes the shape of who they are. But my belief is that if they can receive the help and assistance that they need, the help and assistance that they ask for, that they can regain that shape. There's an ancient Japanese practice called kintsugi. And what it is that when a piece of pottery or crockery or any kind of thing like that is broken, they don't throw it away. What they do is they repair it, typically with gold. They will repair the broken bit with gold. And I love that metaphor or that analogy, because what it says to me personally is that I'm not broken. My flaws don't disqualify me. That in fact, my flaws make me more valuable. Because if we talk about being repaired with gold or some other precious metal, what it means is that the more breaks I have, the more gold is now, the more precious metal is applied to me to repair me in those areas of breakage. And so trauma, time alone doesn't heal trauma. Our kintsugi practice, personal practice, our application of precious metal is the work that we do to heal those areas where we have been damaged by the impact of trauma. And so it's not that people are broken. I would say that they are bruised, and there is the opportunity through the work that they choose to do with us as trauma informed coaches, as trauma practitioners, is to do that personal practice of kintsugi, to allow that healing to take place, leaving them in many situations, if they do the work, more valuable, more precious, wiser than when they started. So that's just my little bit today about flaws not disqualifying us. And so trauma in and of itself is a wound to our psyche. And just like a physical wound on our body, we are going to be tender where we have been wounded in our psyche, where we have experienced trauma. And the thing about trauma, I mean, if you break a bone or you have a wound on your body, it's visible. People can see that. But the thing with trauma is that it's a bit like a wound that's covered with a plaster and we've got our clothes on and nobody actually knows that we are wounded. But what happens is that when people brush up against us, often inadvertently, sometimes deliberately, is that wound is tender to the touch. You know, there's a feeling there that, oh my goodness, I've been hurt by this. And the truth of the matter is that hurt people will hurt other people. And so the work of us as trauma informed coaches is to help people to deal with that hurt. It's to help people to be able to deal with those wounds that aren't visible, that aren't seen, in the traditional sense, but instead are coming out in people's behaviors, maybe behaviors in relationships, maybe behaviors in the workplace, maybe behaviors in families. Our work as trauma informed coaches is to help people to deal with those wounds so that they're able to relate in a much healthier way. Next slide, please. Third slide, thank you. So the first question that I feel is very common when people are being spoken to is, what is wrong with you? It's a question that is often asked in frustration. You know, what is wrong with you? Hey, why do you do that? You know, for the person who is dealing with the after effects of trauma, that is a question that is laced with judgment. You know, the implication is there is something wrong with you. You know, the implication is not something you've done is wrong. The implication is you are wrong as a person, as an individual. And that is a very difficult thing for people to deal with. If I feel that you are calling me wrong as a person, my instinct is to defend myself. And so whatever growth you are hoping to achieve in me, or whatever growth you are hoping for me to achieve, is not going to be achieved because I'm too busy defending myself. And so, you know, it's a common question that people ask. What is wrong with you? If I knew, hopefully I'd be able to do something about it. I don't know, you know? And sometimes there's a noticeable lack of empathy. So sometimes you're experiencing something and you found the courage to speak to someone and say, this is what's wrong with me. You've got the presence, you've got enough knowledge to be able to say, this is what's wrong with me. And then you're met with a comment like, well, what's the big deal? It happened to me. I got over it. Why can't you? This happens to lots of people. And particularly in the field that I work with, women who have experienced or who are experiencing violence in relationships. That is probably one of the worst things that you could say to someone, because it's like a complete denial of the abuse that I have been dealing with. And it echoes what the abuser says to me, that nobody's going to believe you. It's not a big deal. If you didn't make me do this, I wouldn't have to do that. And so we need to be careful. We need to, when we are working with people, we need to be delicate. That shouldn't be a question that we should ask. What is wrong with you? It doesn't open the conversation. It closes it. And it closes it with judgment, with disdain, with an air of dismissal. So really not a great question. Am I going to lie and say that I haven't asked that question? I have, but thankfully I have learned through practice that that is not a question to ask if I really want people to open up to me. The next question, slightly better. Why am I like this? And now this is the person usually asking themselves, why am I like this? And when you sit down to speak to people, sometimes even they don't realize that what's going on is trauma, that what's going on is the after effects of trauma. All they can see is that there are recurring patterns of behavior that they don't like, other people don't like, and is just keeping them trapped. So for example, the person who uses food to cope with with difficult emotions, that's the question they're asking themselves most of the time. Why am I like this? Why do I keep doing this? What is wrong with me? So again, it doesn't lead itself to exploration. It doesn't lead necessarily to growth in any meaningful way. It doesn't help to address the effects of trauma. What it does, it brings feelings of frustration, shame, guilt, despair. When am I ever going to change? What is wrong with me? Why can't I be like other people? And so that question, why am I like this? Again, probably not the best question. And it's one that, as a trauma-informed coach, I try to work with clients to get them to say, ask a different question. Why am I like this is leading you down this path. How about we look at another question that could lead you down a different path, a path that is more expansive, a path that will hopefully lead to growth and insight about what's going on. Because when a person asks, why am I like this? What they really want is insight. They want to know what's going on. Why do I do the things that I do? How can I change the things that I do? So let's ask a different question that can foster that sense of insight and discernment about what is going on in our lives. And lastly, the question that I have started to ask more and more is, what happened to you? To my mind, that is probably one of the most expansive questions that we can ask. It indicates to the person that something has happened and it has had an effect. And when we ask that question, what happened to you? We're then able to apply a trauma-informed lens to the situation. What happened to you? There is an understanding that people are impacted by external circumstances. So, for example, living in a society where we are not the majority, it has an effect. It has an effect when we're dealing with racism or any other kind of ism, disability, all that kind of stuff. When we say, what happened to you? What we're really saying is, tell me more about the things that have impacted you. Tell me about the things that have impacted you in your family. Tell me about the things that have impacted you in the workplace. Tell me about the things that have impacted you in society as a whole. When we take a trauma-informed lens to a person and ask, what happened to you? What we're saying is every part of you is welcome in this conversation. And we are going to recognize the impact of what has happened to you. And so that when somebody sits in front of us and we are seeing every iteration of them, the trauma-informed lens allows us to meet every iteration of them with empathy, with curiosity. We have an understanding that a traumatic event has been experienced, or multiple traumatic events have been experienced, and it has had an effect on a person's life. And the best gift we can give to a person who comes and we are asking what happened to you is that you're not broken. You've been impacted by trauma. Something has happened that has changed your shape. But if we do the work, we can get your shape back to where it should be. And so a trauma-informed coach, what are you going to do? What should you do, or what can you do? It's probably a better thing. Learn about trauma and its effects. Going back to my memory of books, it's something that I still do. If I don't know something, I'm going to find out. I'm going to read a book. I'm going to go to a workshop. I'm going to ask somebody. I'm going to want to know. Curiosity is key. Continue to educate yourself. There's, people might say, oh, you're too old to go back to school. That's true. But lifelong learning is not about going back to school. Lifelong learning is about being open to information coming to you and you seeking out information wherever you can. Like I said, read books, take courses, go to workshops, come to conferences like this. I mean, the beauty of a conference like this is that you're going to hear from so many different speakers coming from so many different perspectives that you're bound, hopefully, to learn something. Ask the right questions. I think by now you know that questions 1 and 2 probably not going to give you the best result. What happened to you is a wonderful starting place, in my opinion. But don't ask questions to satisfy your curiosity. It's not about you wanting to know chapter and verse so that you can ooh and ah over, other people's very painful experiences. You want to keep the person, the client, front and center. Ask questions in service of them. How would this help them? This question that I want to ask, this question that I'm asking, how does it help them? What's it going to do for them? How's it going to affect them? Bear witness to what they are going through, to what they are saying. Hold that safe space for them. Help them to feel psychologically safe as they speak to you. Help them to understand that you are empathizing with them. You are walking alongside them. You're not saying that you fully understand what they're going through or what they've been through, but you're saying, I want to enter into your world and try to see it through your eyes, to try and understand it through your eyes. Don't rush in with advice. That is probably one of the biggest no-nos. They haven't come to you for advice. They want to be able to deal with things and come to their own resolution. If you rush in with advice, it takes away their agency and it shows that you don't respect them. And that's something that the last speaker said. We must respect people. Just because they don't look like us or seem to be like us doesn't mean that they're not worthy of being listened to. We must respect people's autonomy. And importantly, be empathic, but not sympathetic. Sympathetic is where we come from, like, hey, yeah, that's sympathy. It doesn't really do anything for anybody. We want empathy, being able to enter into another person's worldview, not becoming it, not indicating that you've become it, but being able to see things from their perspective. So that's me. Those are the questions that came to my mind when I was thinking about, how the questions we ask impact our response to trauma work. Those are the questions that have taught me in my own practice of what to do and what not to do. And I hope that you found those questions and our discussion around them helpful.
Thank you so much, Ms. Fumi Johnson, for that wonderful presentation. Thank you so much. I mean, you've heard it all. I'm sure you heard when she said, do not ask what is wrong with you. Do not ask such questions. We already know we shouldn't ask such questions. So if you don't know what questions to ask, you don't ask any questions at all right? It's better you ask the right questions. So next, Dr. Paula Rogers will be addressing barriers to trauma care integration within the Nigerian context. Dr. Fola Rogers Saliu, CEO, Vesa Moments Consulting, counseling psychologist, trauma recovery coach, emotional intelligence specialist, business analyst, with over 30 years of experience in human capital development, counseling psychology, HR, education, and healthcare consulting. Dr. Fola Rogers Saliu is a passionate advocate for mental health care, with trauma recovery, and culturally appropriate emotional support. She holds a BEd, MEd, and PhD from the University of Ibadan, with additional certifications from institutions in the UK, USA, Israel, and Australia. She has held key roles, including the Executive Director of HR Admin at CFAX Group, Secretary General to Djibouti Consulate in Nigeria, founder of Rollers Emotional Support and Therapy Services, REST, and co-founder of Triple Passion Home Initiative, an orphanage for children with disabilities. Dr. Rogers Saliu is also a faculty member at CIAPS and has worked with organizations such as Corona Schools, Mobile Pegasus, WAPCO School, and the World Bank's ECO Project for Education in Lagos. Internationally, I'm sorry, please give me a moment. Oh. She served as manager. Okay. Esther, could you please take over from here, please? To wrap up the reading of the bio. Something went wrong with my device right here. Thank you. Esther, are you there?
Okay. Yes, I'm here.
All right, thank you, Esther.
She has held key roles, including Executive Director of HR and Admin at CFAX Group, Secretary General to the Djibouti Consulate in Nigeria, founder of Rollers Emotional Support and Therapy Services, and co-founder of Triple Passion Home Initiative, an orphanage for children with disabilities. Dr. Rogers Saliu is also a faculty member at CIAPS and has worked with organizations such as Corona Schools, Mobile Pegasus, WAPCO School, and the World Bank ECO Project for Education in Lagos. Internationally, she served as a manager of African Emotional Support Counseling at Terence Higgins Trust, UK, and is currently a business development consultant at Fontana Health Card. A visionary leader, she has received several awards for her impact, including recognition from Terence Higgins Trust for her work with the Maisha Mema Group. Fluent in English and Yoruba with basic French, Dr. Rogers Saliu is happily married with children and grandchildren. Welcome, Dr. Fola Rogers.
Thank you very much.
Yes.
Okay. I'm here. I'm in.
Okay. Go ahead, ma'am.
Thank you very much, Esther and Omolayo. Both of you ended up, reading my bio. Thanks a lot. Now, the National Acts of 2014. Let me start by saying Nigeria is one of the sub-Saharan African countries with an established policy in mental health. The 2014 National Health Act has been acknowledged as one of the most innovative reforms within Nigerian health sector. That act provides a legal framework for the organization of primary healthcare services. This essentially guarantees every citizen the right to minimum package of care, It also outlines the importance of emergency and trauma care services. Now, as smooth as that sounds, unfortunately, mental health outcomes across Nigeria are plagued with identified barriers to trauma care integration. Next slide, please. Now, at this point, I'd like to crave your indulgence to explain that you will have to allow me to skip my slides. The way I prepared my presentation was to have the barriers, on slides, and then moving on to the strategies to overcome the barriers. But because of time constraints, I think I'll have to skip. So please, administrator, can we go quickly to slide 9? What I'll do is, as I'm talking about the strategies, I'll first talk about the barriers in a way of, summary. Then we can move on quickly to the strategies for each of the points. Thank you. Slide 9, please. Slide 9. Please, can you move it to slide 9 for me, please? 9, slide 9, the cultural sensitization one. No, that's not it. Cultural sensitization. Please look at cultural sensitization. Let's start with cultural sensitization. Move on. Keep moving, please. Let's keep moving. We're still looking at the barriers. Please keep moving. Next one, please. Yes, thank you very much. Now, as I said, these are slides on the strategies to address the barriers. So for the cultural sensitization, this is about, the barrier is about our cultural attitude. The misconceptions, the spiritual explanations. Mental health is usually linked to cultural and ancestral roots. Whether you are Igbo, whether you are Yoruba, whether you are Hausa, mental health is usually seen as a spiritual problem, or maybe spiritual attack, even connected to our ancestral sins being melted onto, children and grandchildren, or the idea of being possessed by evil spirits. Trauma or traumatic conditions are seen as a sign of personal weakness. When someone is, having trauma, the next person to you will just say, oh, she's just stressed up. You'll get over that. She's just stressed up. You'll get over that. Now, the shame that is attached to those misconceptions and spiritual explanations always create fear for the individual to discuss their feelings or to even access medical or professional help. Also, roles of traditional and religious leaders prevent the acceptance of trauma care services. Now, let us look at how we can overcome those barriers. Now, cultural sensitization through community education and campaign to reduce stigma and isolation. It is important that we create awareness of mental health as a medical or psychological issue and not just spiritual attack. Now, it is also important to align culturally tailored campaign with local beliefs and practices. I'm excited that we're all going to listen to Professor Merino, my mentor and teacher. She's going to talk about the KADBUSA approach, which is a good example of what I'm trying to say, which is something gained from the Yoruba adage. So, aligning culturally tailored campaign with local beliefs and practices will go a long way to help. Now, we also need to encourage traditional and religious leaders to support mental health education, especially in developing practices that will promote healing and referral, that will make them refer. They will know where to stop, where they're going to refer people to further treatment or therapy. Also, in terms of normalizing the conversation, it's important to keep the discussion open so that we can reduce isolation, so that people will have a free space to talk. Just like Mrs. Johnson just said, people would like to ask questions. They need to belong, they need to find groups, they need to network where they can, ask their questions and find answers to some of the questions, be able to share their stories, be able to share their experiences. Next slide, please. Next slide. Yes. Now, the next one is about mental health infrastructure regarding facilities and human resources. Now, let's look at the barriers. We have limited access to mental health services. Now, trauma care centers are very limited. Most mental health facilities are in the urban cities, neglecting the rural areas. Now, the ratio of psychiatrists and professional health workers to patients is rather too low for mental health population and general population. Now, the 2023 report of WHO confirmed that in Nigeria, there are over 40 million people affected by mental illness. And this is a country with just about 350 psychiatrists, hospitals. Now, how do we move from here? One, it is very important to have government to expand their services, to provide physical facilities, build infrastructure, decentralize services to rural areas. Also, develop training programs and make use of technology. Imagine you're trying to book appointments and then you go online to do that. Or you need to speak with your support worker. You can do that on phone. This is what happens in the place where I am now and in many other countries like, England. Also, task shifting is necessary to provide mental support in training non-specialist health workers and volunteers to provide support. Now, let's move on to the next slide, please. Yeah, this is about policy and government support. Now, we have said it, I'm starting with the barriers now. We have said it that Nigeria is one of the countries with an established mental health policy. But the history of implementation of reforms in Nigeria is really, really poor. There is weak mental health implementation. Now, trauma care does not have prominence at all in the budget. If at all, mental health is considered in some facilities, resources are very, very limited. So what do we do? Now, I'm looking at governments and healthcare providers scaling up mental health care and integration into the primary health care, and general medical services. Now, funds will have to be released. More funds will have to be released for training, to employ more people, especially with the incidence of a lot of people leaving the country for greener pasture. I'm talking about the Japa syndrome. Governments will have to entice specialists, by giving them more salaries, good conditions of service, and so on and so forth. And it is important also to overhaul the national healthcare system. Governments will need to integrate trauma care as part of mental health services, especially, we can, let me give you examples of what has been happening, especially supporting the NGOs' activities. We all listened to the KADBUSA story. We listened to AHI. These are agencies making efforts. I think more of this will have to be done. And then probably would need some NGOs too, to kindly form, pressure group to kind of speak to our government to do more in integrating the mental health and trauma, care into the health services. So I think I need to go on to the next slide now. Yes, let's talk about the traditional and the religious leaders. Now, the barriers. Their approaches do not align with trauma care principles. For the religious leaders, most times they are looking at prayers and fasting, And then the traditional healers, their actions and support are quite shrouded in secrecy. So what do we do about this? Now, collaboration with these traditional healers and religious leaders will go a long way in creating an integrated approach to trauma care. They need to be trained in basic trauma awareness for wider acceptance. We require spiritual and cultural practices that will promote healing. I'll give you a quick example. When I was working in England in a culturally appropriate project, I was working with HIV clients and, supporting them in many ways, especially encouraging them to take their antiretroviral medication. And they will come up to say, oh, Auntie Fola, yes, we have learned we need to take our medication. But I tell you what, before I take my medication, what I do is to pray. I put the medication in my palm and I pray for it to work. I pray that it will go to the right organs in my body. This is what, I'm trying to say. So it is also important to guide against practices that will contradict mental health principles by these our leaders. In many cases, some of the pastors in the religious setting would tell their clients all they need is prayer, and then you must have faith. If you have faith, you will be healed. And then somehow, they are not even encouraging some of them to take their medication. This is not what we are talking about. And for the traditional healers, we've had, people sharing their experiences about how they were locked up, how they were isolated, how they were, being beaten, because the idea is to beat the evil spirit out of them, So you can imagine how more traumatic that will be to a trauma survivor. Let's go on to the next slide, please. Yes, that is economic assistance. This is about the economic barriers. Economic barriers are high cost of treatment, medication, and therapy. Now, for people to travel to the cities, to receive treatment or care, you imagine what that would mean in a country like Nigeria, where everything is going up, especially the chaos of transportation. how are they going to get the money? How can they afford it? People in the rural area, even within the urban centers, how many people can afford to travel for treatment, for therapy? And then insurance policy does not cover mental health illness or any trauma care case. The so-called HMOs that we work with in Nigeria will not cover anything on mental illness or even acknowledge any trauma. You can, except for people who are so lucky to be sponsored by all these highly placed corporate organizations. But how many people would that affect in the population? Now, trauma care is too expensive wherever it is available. I know that there are a lot of private initiatives at the moment, giving trauma care, supporting people apart from the non-governmental organizations. But I tell you, it is not cheap. It is not cheap. Something will have to be done in terms of, giving a free or subsidized trauma care assistance. Government will need to impute a lot. They need to develop community-based support groups where people can easily access support. They need to fund such support groups. They need to even encourage more people to form agencies and organizations. And then it is also necessary to establish trauma recovery centers. So integrating trauma care into the universal health coverage too will do a lot to make trauma care financially accessible to all citizens. That might sound a tall dream, but starting somewhere will really help the situation. Next slide, please. Yes, trauma-informed education and training. Now, you have barriers as limited training and human resources issues, inadequate awareness among health workers, and sometimes wrong diagnosis. Now, as a proud alumni of Jazz Institute, I am an advocate of trauma care being integrated into the curricula. At the moment, the trauma-informed care is not a standard part of medical and nursing training in Nigeria, either in government institutions or even private institutions. So this is very, very crucial. So, and the debate around emphasizing socio-economic and psychological aspects of trauma, it is important to train people so that they can focus on the social aspects of trauma, like safety, trust, empowerment, peer support, and also the economic aspects, which is basically financial resources, and more importantly, the psychological aspect, so that they are able to understand the initial reactions to trauma, anxiety, frustration, agitation, dissociation. And also, they should be able to recognize signs and symptoms of trauma. They should realize the impact of trauma and the paths that are necessary for recovery. And also, be able to integrate what they know into policies, procedures, and practices. So let's move on to the next slide, please. That is integrated care models, talking about accessibility and holistic model. Now, with this, the barriers are lack of integration between physical mental health services. Trauma survivors are treated for physical ailments, but no mental health support at all. How do we go about this? We all know that trauma-informed care is a compassionate and empowering framework. So trauma care would need to be integrated into the general healthcare system and then allow screening for trauma symptoms being included in routine checks, for example, so that they are able to provide necessary assessment. Imagine that we get to a stage where people can go in for trauma screening as you go in for, breast cancer, screening, or sugar level screening, or taking the pap smear, endoscopy, and all of that. If we can get to this point and have trauma symptoms being screened in routine checks, I think that will make a great milestone. Now, community-based mental health care programs will be introduced, they will be necessary. All the agencies, all the NGOs, all the programs in the states like Kaduna State, because they are really doing well, we would need more of this. Because if you go to the communities, then you are reaching out to more people. And referrals can be made to the appropriate quarters. Now, they also need to expand roles of community health workers. It's very, very crucial. Thank you. Now, my last slide is about the mobile trauma care units in conflict zones. In all the geopolitical zones of the country, there is widespread trauma arising from displacement, crisis, one crisis or the other, financial difficulty, having refugees, like look at what happened in Jigawa recently. Imagine the enormity of people who are homeless, who have become homeless because of the flood crisis. We have internally displaced people, especially, in the north. Now, there are too many crises to contend with. We've got the Boko Haram in the north. You've got the kidnappers across the nation, the IPOB activities in the south, banditry everywhere in the west, south, and almost all over the country. Almost no support for trauma care in all of this. So how do we navigate this? We need to deploy, I'm talking about government deploying mental health response team to such places. They need to offer psychological first aid and counseling. They need to provide referrals for long-term care. They need to prioritize support for the refugees because the IDP camps are in very deplorable situation. Many people die every day. That may not be in the news, but that is what happened. That is what happens on a daily basis. And also, they need to train personnel to support survivors of violence and such conflicts, and also people with displacement trauma. Now, my conclusion. It is very essential from the little I've been able to say and from what we have had before, that the joint efforts of governments, non-governmental organizations, traditional healers, religious healers, and healthcare providers in Nigeria should focus on providing community-based interventions, increase awareness, build infrastructure, and provide trauma-informed training. So let me leave you with this statement. Trauma is real. trauma-informed care is relevant and healing is possible. Thank you very much.
Thank you very much, Dr. Fola. That was so wonderful. Thank you so much. It was just really, really good to listen to you talk about how trauma and things that we can do to take care of of trauma in Africa. One particular thing that stood out to me was when you said only if we could go and go like we go for the regular screening for breast cancer and all, if we could have regular screening for trauma, I think that would go a long way. And thank you so much. That was such a wonderful presentation. Thank you so much, ma'am.
Thank you.
Okay, it's been a long afternoon, and right now we'll be having something quite interesting. I don't know if you are ready for it. If you are ready, say yes, yes in the comments. Right now, we're going to have a very short aromatherapy session. So if you have any type of fragrance around you, there's a video for you to watch and also use it to just release and get calm again. So, do we have the video ready now?
Centuries to treat
And if you have been following, say good, or use a word that describes how the sessions have been for you. I want to see the chats popping. I'm yet to see it. Are we responding? I'm waiting to see it. Are we back? If you're back, say I'm back in the chat. I don't see you. Okay. While we wait for your comments, up next, we'll be having our speakers. And I invite my colleague Omolayo to take over now. Omolayo, are you there? Okay. Looks like she's having some network issues. So I'll just continue. Please, between now and as the next speaker comes up, please use the comment section to give us feedback about things that you've been getting from the conference. What are key points that you have been receiving from listening to the speaker, or take the time to just appreciate a particular session that you enjoyed the most. So next we'll be listening to Tolushe Francis, who will be speaking to us about youth and trauma, shaping the future of Africa trauma care. Tolushe Francis, a biochemistry graduate from Bowen University with an executive MBA from Quantic School of Business and Technology, USA, boasts experience. He began his career at Jumia, Nigeria as a hub manager and later contributed significantly to GIG Logistics e-commerce product growth. Passionate about mental health, he served as the COO at Mentally Aware Nigeria Initiative and holds roles in various mental health organizations worldwide. Tolushe is a renowned speaker, therapist, and author with an international recognition from organizations like the BBC, WHO, Lancet Financial Times, and the Global Health Features Commission. He's a dedicated member of Rotary International and a PhD candidate at Charisma University. His extensive achievements include recognition by the Lagos State Government, MIPAD's 100, Under 40, and numerous awards in health and blogging. Tolushe's commitment to mental health advocacy shines through his podcast, YouTube channel, blog, and published books. Welcome with me to Lucia Francis.
Hello, can everyone hear me?
Yes, we can.
Okay, good afternoon, good morning, good evening, wherever you're joining from. It's a great privilege to be here. I don't think this lighting is doing justice, so I think I'll just change my location. The light is too much on me. Give me a second, please.
Okay. Okay.
Yes, this is better. This is better.
Okay. Yes,
All right. So, yeah, thank you for having me. It's a great privilege to be invited to speak here at the Africa Trauma Care Conference. Congratulations once again to Dr. Professor Merino. Doing this consistently is not an easy feat. She's always the ginger for my annual Mental Health at Work conference that I hold every May, because I ask myself, if Prof can do ATCC every year, then what's my excuse? But it's good to be back here again, and quite an interesting theme this particular year, bridging gaps, and I'll be talking about youth and trauma care. I have no slides today, it's deliberate. I spoke with Bimbola that when I do slides, I'm kind of like conscripted, but I do have a write-up which I've shared with her that will be shared with everyone later on. But I'm going to use what I've written down deliberately because I don't want to leave anything behind, and I want to be able to, cover that which I really want to talk about today. So come along with me as we look through this together. So I'll begin with an introduction where I said defining the impact of trauma on Africa's youth. Defining the impact of trauma on Africa's youth. And I said, I begin by defining the impact on Africa because I want to emphasize the physical and psychological trauma. I like the challenges Africa youth face, amongst other things. Then look at the ripple effect, of all of this. So it's important that we look at all of these one after the other. So I'll begin by asking ourselves, we've been talking about trauma before now, and it's important that we ask ourselves what exactly is trauma. So maybe because I love to teach, I love to explain things to people, so I usually like to have some of those questions, highlighted, in terms of how I speak, So let's look at what are the significant challenges that African youth face. I live in a country called Nigeria that exists in a continent called Africa and a subcontinent called West Africa. And a whole lot of things happen that creates trauma for youth. We had the one of Kenya where the youth took to the streets, making demands and all of those things. We had one in Nigeria in which we celebrated, or we marked, not celebrated, we marked the 4th anniversary of the EndSARS Lekki Tollgate issues. Now you have the trauma that exists from conflict within communities, that exists from the economic crisis that exists in our environment, in our country as a whole. So you would understand that there are always things that are happening that creates traumatic experiences for people. You have children who do not even know anything about their father, and then one day one man shows up and says, "I'm your father." You have disjointed homes or broken homes, as the case may be. You have people who are struggling with understanding the challenges that they face in academic setting, where probably a lecturer is asking for sex for grades. You have a lot of these experiences from people and, youth specifically. And so it's important to understand that these circumstances are multifaceted. They are coming from different angles, not just one angle, and youth have to face it every day. It would interest you to know that at the World Federation for Mental Health, where I currently serve as Africa Regional Vice President, we have created a new section called the Youth Section. And that's because we want that to be able to address matters of the youth and subsequently be rolling out products. Now, it's also important to know that we've also had reasons to, to have the women's section of the World Federation for Mental Health, which is focused on the crisis, the mental health crisis of women. Now, it will interest you to know that some challenges are peculiar to genders, while some aren't, some are natural. Every youth faces the same thing as a youth, but the context may be different in terms of gender, in terms of sex, and all of that. So let's look at what we have in terms of Africa as well. So I'll talk about rates of violence, abuse, and sexual exploitation. Abuse is so predominant in our community today. I'm focusing on Africa because this is an Africa Trauma Care Conference, right? So let's beam the searchlight on Africa. Forget what's happening in Europe. Forget what's happening in Latin. Forget what's happening in Asian continent. Let's beam the light on Europe. We have a lot of crisis going on in Africa. And beam the light on Africa, I meant to say. A lot of crisis happening in Africa. You have people who are traumatized for one reason to the other, right? You have people who are going through a whole lot of experiences, child molestation, child deprivation, So it's important to look at country by country or sub-African region to say, look, what exactly is it that Africa is experiencing? What are some of these trauma or events, so to speak, that creates trauma in youth? Because at the end of the day, you must understand that the youth is a youth, right? And it's important to understand that being a youth deals with age. Okay, being a youth deals with age, right? And being a youth means that you are at that moment of your life, that period of your life, where you're supposed to be active. You're supposed to be bring the vibe, you're supposed to bring vibe to wherever you find yourself because you have strength. You have strength within you to be able to pull through, right? You have strength within you to be able to pull through. Sometimes the data might say adolescent mental health as against youth, in terms of trauma, because in the specialty of mental health, there's really nothing like youth mental health. What you have is child and adolescent mental health, right? So it's important to understand that you may have that dichotomy in terms of usage, as a whole, right? But it doesn't take away the fact that it exists. It doesn't take away the fact that youth, day after day, day in, day out, are experiencing this. And there are a lot of articles out there that point us to the fact that people still talk about the Rwanda genocide, right? You have the Democratic Republic of Congo. You have children soldiers in some of these countries who are thrown out there at the age of 15, to go out there and begin to carry guns as a way of defending their country. Now, imagine how these ones grow up and their perception about that. Now, some stats that I would like to share with us from the World Health Organization as at 10th of October says that globally, 1 in 7 10 to 19-year-olds experience a mental disorder, accounting for 15% of global burden of disease, right? It goes further to say that depression, anxiety, and behavioral disorders are among the leading causes of illness and disability. I know that we are looking at trauma, but let's not forget that trauma is not always something that happens physically. Now, in medicine, for those who are doctors, watching or who would watch this later, trauma in orthopedics is different from trauma in mental health care. Let's get that clearly, right? Trauma in mental health care is a different ballgame entirely because it's not something that is seen on you physically, right? Is a consequence of something that's happened to you. It's a consequence of things that you have experienced. That's trauma as far as mental health care is concerned. It's different from trauma medicine where you're dealing with an impact on a person, or maybe in orthopedics where you're dealing with an impact on a person. So the great question of what are those things that could happen to a person that could create trauma in them? That's how we look at it in the mental health field, right? What are the things that could happen that as a result of that trauma, right? As a result of those things, right, that person experiences trauma. And so you have grief, for example, right? You have grief, you have accidents that are happening, you have molestation, you have child slavery, and a host of other things. You have verbal abuse that could create trauma in a person, and how a child grows. The memories are carried on as the child grows. The memories rest with that child, right? That it takes care, which in this case is probably therapy for that person to outgrow that particular experience, right? And understand that, okay, I have to deal with this, or I have dealt with it. And so when I read those stats and they mention depression, I want us to understand where they are coming from. That it doesn't take away the fact that it's trauma, but these things have happened that have led to this, right? And one of the things that studies have also shown us that some youth are at greater risk of mental health conditions due to living conditions. So you have stigma, for example, which could traumatize a person. You have discrimination or exclusion. You have lack of access to quality support and services. People are living in fragile environments. They wake up every morning and they're not even sure what the next thing would be. You know, they wake up and they're clenching their fists because they're not sure of what could happen. They are defenseless, right? I read an article recently that talked about trauma exposure and post-traumatic stress symptoms in urban African schools. And this survey was done in Cape Town, South Africa, and Nairobi in Kenya. Now, come along with me. Let me give you what the result of that study was. So first of all, and I want to use this to discuss what I want to discuss today, and I promise you that I'll be out of your faces in no long time. Now, they assessed trauma exposure, PTSD, and gender differences in adolescents in Cape Town, in South Africa, which is in Southern Africa, and Nairobi, Kenya, which is in Eastern Africa. Now, they sampled 2,041 boys and girls from 18 schools. Anonymous, right? Self-report questionnaires. Now, what was the result? More than 80% reported exposure to severe trauma, either as victims or as witnesses. And I would like to dwell on these witnesses a bit, because sometimes we think that it's the person who took part in the actions that gets traumatized the most. I fear to break this to you, that witnessing an event is enough to create trauma or chaos. Yesterday, I was on TikTok. Was yesterday first? I was on TikTok, and the conversation was going on around why homes get broken, or whether a woman should remain in the house, in the home, in the marriage, and put it that way, whether a woman should remain in a marriage, even if domestic violence is happening there. And I was hearing a number of comments. And for me, it was conversations like that are usually a trigger for me, because it hurts me when I read stories of people who died because we were trying to remain in a marriage. I'm not here to tell you to say leave your marriage, right? But the burden of care says that you should, excuse yourself from a toxic environment, and you can always address it from that end, rather than being in that toxic environment and trying to address the toxicity of the other person that you have no control over, right? And one of the things that I said to them is, so you hear women who say that they are staying there because of the children. And the real question is, you staying there because of the children, and the children are watching all that is happening, is traumatic for them. You may not know until they go older a bit, and then they begin to relive the experiences that they've had. And some of them make some decisions that has come to be part and parcel of them as adults. Or even some of them go ahead to behave in the way their father or their mother was behaving back then, because they think that that's the best way to behave, right? So we must create this balance to understand that it's not only those who are partakers of these wrongdoings or these social vices that get traumatized, but even those who witness it, right? A child who witnesses a man shoot another person is traumatized by that, and he grows up with that trauma. He didn't shoot the gun. He wasn't the one who was shot, but he witnessed it being shot. And you are telling him that what will he now do if he was the one who had to do the shoot, or if he was the one who did the shooting? Trust me, the traumatic experiences are not measured that way. The most important thing is there is a view of it, or there is a witness of it. Now, so they said 80% reported exposure to severe trauma, either as victims or witnesses. Now, in Kenya, compared with South Africa, Kenya had significantly higher rate of exposure to witnessing violence. So Kenya had 69%, South Africa had 58%. Physical assault by family member, 27% versus 14%. And sexual assault, 18% versus 14%. Now, when it came to the issue of PTSD, which is post-traumatic stress disorder, for those who had full symptoms, the margin was wide. Kenya had 22.2%, South Africa 5%. And for partial PTSD, 12% versus 8%. Now, boys were likely as girls to meet PTSD symptom criteria. That tells you that it really has nothing to do with gender. So like I said, you have a lot of these events that happen that could traumatize youth. You have rates of violence, abuse, and sexual exploitation. For those in Nigeria, sometimes was it last year or 2 years, early sex for grades stuff going around. You have the impact of armed conflict and displacement on children and adolescents. Many years back, there was the Ifya Modakeke war that was happening. You know, a lot of people were displaced. That was in southwest Nigeria. At some point, you had the Cameroon-Bakassi Peninsula crisis, which was between Cameroon and Nigeria. This time around, the Calabar region, which shares border with Bakassi. In Cameroon, you have that experience. You have those pockets and pockets of violence that are happening, and this has a way of displacing children, separating them from that life that they are used to, that life that they're exposed to, and then they have to pick up their lives again, and they struggle, you know, with the experiences, the flashbacks. You have poverty in the land, you have economic instability, you have social exclusion, and this contributes to both physical and emotional trauma. Right now, for a country like Nigeria, we're experiencing, you don't even know what name to call it, right? If you go to the market and you buy this at 10 naira today, you're not sure how much you buy it in the next 5 hours. And this alone is traumatic because you're not sure what you're earning, what your purchasing power is anymore. So you wake up every morning and you ask yourself, okay, yesterday I was able to buy stuff for 1,000 naira. Today, I'm not sure what this 1,000 naira can buy for me. And so even though you have money, it's as though you don't have money. That's enough. A traumatic experience for anyone out there. So you see these pockets, you know, existing here, and then this trauma could start from physical and then it becomes emotional, you know, on that particular person. But what's really the ripple effect of this, which I'm going to use to just as a wrap up? What's the ripple effect of this? You have increased rate of mental disorders like PTSD, anxiety, and depression. If this trauma is not addressed, in this condition are not addressed, the change, or the child is not brought, the teenager, the adolescent is not brought properly to a place of care, you have this person begins to experience increased rate of mental disorders. Like I said earlier, PTSD, depression, anxiety, and they all exist there. The impact of this trauma may have behavioral issues. Recently, I was sharing with some people that when you see someone who is into substance use or substance abuse, don't be quick to assume that the person chose to be rewarded. Nobody wakes up and decides that, you know what, I am going to believe in this particular way, or maybe in this particular way. But the experiences that this person has had, which in this case is trauma, the exposures, what they've been exposed to, could lead them on that journey of living that way, so like substance abuse, violence, or criminal activity. Another thing that we need to consider, right, that could serve as long-lasting consequences of unaddressed trauma is impaired cognitive development and educational outcomes. Yeah. So their cognition develops slowly, you know, and this begins to hinder their future opportunity. So imagine a child who is displaced and finds himself in an area where it's okay to not even know how to speak the language that is globally and universally used, you know, or is not even able to go to a kind of school that helps the development of the person's cognition. As that person grows up to become a young adult, you begin to see the effect. How does this person think? How does this person behave? And you're wondering, where did you grow up? These are one of the ripple effects of how trauma can impact future health and development. And as a whole, so that we don't think that it's that person's problem, it can create a weakened workforce, right? So imagine if you have a population where the workforce, which is usually youth, yeah, the workforce is traumatized, you're going to have a big issue with your workforce. You're going to have a big issue with those that you employ. How then do we deal with this? We must begin to deal with the barriers to trauma care in Nigeria by addressing certain things. One is stigma. Stigma. We must deal with stigma. We must not allow people to be trauma stigmatized. That they experienced it is not their fault, but we all have a responsibility to make them know that it's okay to have experienced it, but it's not the end of the world and it doesn't define you. We must deal with limited access to care, infrastructure, trained professionals, resources. Let us have more resources that provide trauma-informed care, especially in rural areas. Are we able to speak in a language that they understand? If we send you to Ife in southwest Nigeria or Osun State, Are you able to speak in their language to get them to understand what is exactly happening or what you want to offer them? If we send you to Enugu in Enugu State, are you able to speak the language to them so they understand and bring it to their level? I always say that you take people from what they know to what they don't know. You don't take them from what they don't know to what they know. And sometimes coming down to their level could mean speaking in the language that they understand. So they are receptive and able to apply it to their lives. Okay, exactly, this is what I'm struggling with. You have cultural beliefs. Traditional practices may sometimes clash with modern approaches to mental health and trauma care. So we need not to create resistance. We need to look at what are the cultural beliefs of these people and infuse it. Sometimes people come for therapy and they ask me, am I a Christian? I tell them I'm a Christian, but I'm professionally trained not to use my religion as the basis of treatment. But is that what you want? So if that's what the person wants, I take them, I go through the route that they are conversant with. But the ultimate goal is to bring them that care that they need. So you could have scenarios like that. So you could use cultural beliefs to take that person from what they know to what they don't know in order to be able to give them that care. I know that not everybody here is a professional listening to me or watching me, but that means that we all have a responsibility to have knowledge, which is what this conference is all about, on trauma, right? And to what role do I have to play with respect to this? I may not be able to treat, but at least I can provide some form of first aid and I can refer to the right persons. And of course, lack of awareness, what I was trying to say, that it's important that people are aware. You have mental health first aid, you have psychological first aid, you have conferences like these where you get educated. Now, what is the role of education? If you want to build, we need to build a trauma-informed generation. And education is key to breaking the cycle. We must have a trauma-informed generation. Let us train teachers, educators to identify and address trauma in the classroom. A child is throwing tantrums. You don't see it as that child being stubborn, as that child being playful, but you're able to decide to say, why is this child behaving like this? And then you pay attention to those patterns, right? Let us create safe spaces within schools where students can talk and process traumatic experiences. There's a gossip bench in Kenya, for example, where you just go and sit down. There are elderly persons there waiting to talk to you right there in Kenya, right? You have some NGOs who are just there, you want to rant, just call, right? Can we have those kind of spaces in schools, tertiary institutions, for example? I remember back then, when I was in uni, we had these chairs, outside there. And sometimes I just go there to sit, I just go there to sit. And then whoever comes, I engage them in conversations. And trust me, it's always been rewarding. Can we have that in schools? Can we have that in our parks, right? Where people can go just sit down and someone walks up there and someone's able to have conversations with them using what they are familiar with, what they are passionate about to lead them in that journey of healing. Can we develop curricula that would incorporate mental health awareness, not mental health care, but the awareness and teach coping skills? And of course, let us encourage collaboration between schools, healthcare providers, and families so that we take the care to them, right? And so you begin to have community-based trauma care, peer support networks, telemedicine and mobile health, and a public-private partnership. So in order to give a wholesome kind of care, we are building community-based trauma care. You're having a peer support network system. Telemedicine is there, and mobile health. You can be where you are and receive care. And then, of course, can there be a partnership? NGOs partner with government partner with private organizations, and so on and so forth. Government can't do it alone. Private establishments can't do it alone as well. And I want to call on all youth just like me. Let's empower the future. Can you serve as advocates for trauma care? Can we have campaigns that destigmatize trauma and mental health in our communities or mental illness in our communities? Can we have youth who participate in youth councils and advisory boards that help to shape national healthcare policies? That we set up these boards, advisory boards in NGOs, in organizations, government parastatals. Can we infuse the youth into these boards to bring that bubbling energy that they have and that knowledge that they have? And let's build a society that is youth friendly and that has the youth at heart. And of course, let us train peer counselors or first responders within our schools and communities. We send these youth out. I know that there is an organization like Money, Interway Nigeria, that has student advocacy network. Within schools, they are trained and they serve as first responders to their own peers who are in crisis. So what's my call to action to us all today? My call to action is to challenge everyone who is watching, who is listening, who will watch or listen, that you all have a responsibility, every one of us have a responsibility to build a trauma-informed society. As youth, we must rise up and change the status quo. We can't leave it to the professors and the doctors who have spent years and years of studying alone to do this work. There are courses that you can take that will educate and empower you to at least be a first responder. And trust me, it starts from there, and one after the other will change the face of trauma care in Africa, and especially amongst. Thanks for having me.
Thank you, Tolushe. That was really, 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 really insightful. We have to take on the responsibility of taking care of people and making trauma care our responsibility. If you've been following in the chat, say yes, we can, and yes, we will, because we have to. We just have to. There's no other option at the moment. Thank you so much, Tolushe. Thank you very much. Okay, I invite Omolayo to take over.
Thank you so much, Esther. Thank you. Thank you again, Tolusha. That was insightful. The youth are the drive of any economy, and they have to be on top of health if the economy will thrive. Still on the subject of the youth, patients injury will be exploring techniques and avenues that institutions can utilize in trauma care approaches. Patience is a Kenyan-based youth leader and climate tech founder. Patience runs Green Skills for Youth, an initiative that promotes environmental literacy and mobilizes for impactful climate action. Green Skills for Youth addresses themes such as climate mental health, climate justice, equity, and community empowerment. Patience is a doctoral student and holds an MBA. She's keen on literacy programs and is a youth leader who believes education is the key to realizing sustainable developmental goals. Passionate about community and youth, Patience leverages inclusive approaches to empower a generation of change makers and accelerate Africa's transition to a sustainable digital future. Welcome, Patience Injury.
Hi everyone, thank you for having me. So today we are going to be exploring the techniques and avenues institutions can use trauma care approaches to empower positive, transformative societal change. So to start with, maybe we can just have a look at some of the complex issues that society is facing today. So there are very many complex and overlapping issues that are in the world today. Some of them include systemic racism, climate change, forced displacement, and also things like the pandemic. So, and all of these can cause trauma, and this trauma can be passed from one generation to another. And some of these traumas include intergenerational trauma, collective trauma, historical trauma, cultural trauma, multi-generational trauma, and transgenerational trauma. All of these things contribute to how society is at the present. So I would like to start with an interesting statistic that I came across, and this was saying that 2/3 of the youth today are exposed to traumatic events, whether directly or indirectly, before the age of 16. So you can imagine how much impact that has on them as they grow up and as they also transition into adulthood. So in line with this year's Africa Trauma Alliance themes, we are going to be exploring these techniques and avenues that institutions can use. And so with that in mind, we can start by maybe looking at these challenges, because we're also looking at the gaps in these institutions. They're also looking at ways policy can be improved so that everyone becomes part of this change that we seek. So some of these things that we're going to be looking at is how to implement these in institutions. First is just understanding the need for a standardized language when it comes to trauma-informed approaches in institutions. So there is always no particular definition of trauma to start with. Everyone has a different definition depending on different things and what they mean to them. So because there is no like standardized way to gauge trauma, a lot can be misunderstood or even left out in these institutions trying to tackle the same. So one of the important thing that people can do is just find a standardized way to not exclude anyone and not to diminish any trauma, because some of the youths get left out from benefiting care from trauma-informed care practices in the institutions, because maybe some of them may feel left out. They think that, oh, maybe because this and this did not happen to them, then they do not deserve this kind of treatment. So there are many there are many myths that surround trauma, and one of them is that everyone who has there maybe just to mention a few. One is that everyone who has mental ill health has experienced trauma. So that is one of the myths that may exclude some people from seeking trauma, from seeking the services that they need to overcome these things, or for seeking help. And also there are people, mostly the youth. I'm talking because these are some of the experiences that people share, and most of them maybe do not seek for help because they think, oh, well, maybe this was my fault. Say someone has been through a traumatic experience as a youth, especially because most of them are at their growing up phase and they're very self-aware and also keen not to look bad. So some of them may not seek help because of a few myths. So one of them, they think it's their fault. Another thing they may think is that only bad things come from traumatic experiences. And some of them assume that if their life has to be threatened for an instance to be like trauma, to revolve around trauma. They think that their life has to be threatened. They also think that only PTSD is a common response to trauma, and so many more. So a way that institutions can harmonize this is to standardize the language that they use to help those in these situations, especially the youth who are growing up. So number two, we're going to talk about the payment consideration. So as a lot of the panelists have brought to the table, there is always this issue about the incentives surrounding this work. And to be honest, some of the youths especially may be struggling to make ends meet. And for this reason, they might neglect seeking help, especially for their mental health, because maybe they lack the necessary funding, or maybe because of the myths that I just mentioned. And the thing is, just institutions finding ways to harmonize these things, these payment structures, and also offer help where necessary is also key. And again, we're going to maybe look at how awareness building and competency is also key in trauma work, especially for the youths. So we always see a lot of campaigns in schools. Maybe there's always drug campaigns in schools. We see them everywhere. Maybe there are also others like people should put on their seat belts. There are always so many campaigns that the youths come across. But one thing that keeps getting neglected, especially in the African setting, is taking care of mental health. And so just like we have those awareness in schools for drugs and all of that, and road safety, I believe that also just including trauma work and how it affects people and growing up and the youth into these campaigns, either through marketing, through social media, through public service announcements. All of this can be key in just building a better society for all of us and just contributing to the change we need to see. So another area maybe I'd like to shed some light on is trauma in the workplace. So some of the ways trauma manifests in the workplace. The thing is the youths are part of right now, most of them are transitioning into employment, or they're already part of the workforce. And so some of the ways that people can recognize manifestation of trauma in the workplace is by things such as higher turnover, higher absenteeism. And there was a statistic I came across that about 200 million our 200 million work days are lost per year because of traumatic experiences. And so I was mentioning about high turnover, high absenteeism, and also high presenteeism. So it doesn't only mean it doesn't just go about on the absenteeism. There's also high presenteeism, where you're present but not really being productive in your workplace. And so this statistic found that about 3 times this high presenteeism in organizations can lead to 3 times more cost on the employer as compared to absenteeism. So this is also quite key to note. And then there is also lower productivity. And yeah, there's always a link between depression and functional impairment. Yeah, so those are just some of the trauma manifestations in the workplace. And so there was this study by Deloitte that I wanted to just quote that found that it took about 3 years to see a positive return on investment in mental health and holistic wellness supports in institutions. But the thing is, more and more people right now need to invest in this trauma-informed care work and policies in the workplace, and also hire people with this knowledge, because this is quite huge. And so one of the things that need to happen, we need to see these gradual shifts in the workplace. We need to see this trauma care work gaining momentum in the workplace, and also celebrating these small wins that take place when people know how to deal with their traumas and be productive at the end of the day. So there is that in the workplace to also note. And on top of that, so with that in mind, what I just discussed, those are the manifestations of trauma. So we are going to have a look at how organizations can handle this. And one of them is by hiring trauma informed care workforce. So the importance of this is because these people who get hired can manage to identify these manifestations in the workplace. They can manage to identify people who need this help. People are not being productive enough, maybe because of the things that they've experienced and continue to experience. So that's just one of the ways that that's one of the techniques that organizations can apply and try and bring a trauma care approach to the workplace. Another thing is to lead and communicate transparently about the whole process of trauma. A lot of the work you're not able to get when you lose a loved one, when you're struggling with various things. There is a lot of things that people struggle with on a day-to-day basis, and some of them in the workplace, they may affect you in the workplace, but nobody gets to talk about it, especially in Africa, where in as much as people are told when they join these companies and all of that, that we are a family, we work together, we care for you, most of them do not live up to it. And part of this is because they do not care about their personal life. It's just get to work, do whatever you're meant to do, get paid for it. You're here on you're here based on what you can deliver. So instead of all of that, we need to now transform how organizations are approaching trauma and recognizing its effects on its workforce. And so part of this is leading and communicating, as I said. So organizations need to bring together all the key stakeholders and just speak to them about what is needed to be done, where the gaps exist, what can be done. And this communication, sometimes in the workplace, you find that there is barriers to communication, maybe because of the hierarchy or maybe organizational culture. But one thing organizations can do is lead from the top members all the way down, is just lead and communicate effectively on trauma and its work, and also plan. So all stakeholders need to be part of the planning. So whether you're in the executive bit of the business, or maybe you're just working, so everyone has to get involved and they have to do a thing or two about trauma, and also safeguard the workplace, because it's one of the places that people get to spend a lot of time and also just interact. So, and then another thing is to provide safe spaces. So a lot of people these days get to go on these wellness retreats, and here in Kenya we are seeing positive improvement in this area, because a lot of organizations now reimburse people for different wellness activities that they carry out. So if you want to maybe join a gym just for your health, that you can get reimbursed for that. So if you want to go for a wellness retreat, people are getting reimbursed for that. So in as much as there is a lot of change needed in our society, we are also like celebrating these small wins that we keep seeing every day, and the organizations that are striving and doing their best to just help others and also incorporate all of this. So maybe I can touch on also what's going on in for the healthcare practitioners who need to offer this trauma informed care. So the good thing about trauma informed care is that it shifts your focus from what's wrong with you to what happened to you. And this understanding must involve both organizations, clinical practices, and all of that recognize the complex impact trauma has on patients and also its providers. So maybe I can look at the people who are offering this trauma care. Oh, sorry about that. So I wanted to look at maybe the healthcare practitioners who are also prone to vicarious trauma because of the exposure to people who've been through traumatic experiences. So I'm just going to mention a few things that maybe can be implemented on policy just to improve how trauma care work is being done, especially here in Africa. And one of these ways is by modifying the mission statements of, well, this one falls under the workplace. So modifying the mission statement, changing HR policies, amending bylaws, allocating resources, and updating manuals is going to go a long way in seeing that people get the help they need and be part of positive transformative change. And also for the clinical approaches, as I was saying, I wanted to talk about the healthcare practitioners who are giving this trauma care in these institutions and what they can do. So a lot has been said about trauma, and so part of these practices, especially for those administering this, because this is part of this year's trauma care Africa theme. Part of this is empowering the patient, um, being open to their choice, collaboration, safety, and trustworthiness of all these happenings and dealings in trauma care work. So this is one of the things that need the clinical practices need to reflect. And sometimes in Africa, people fail in this particular area because sometimes you may be going to seek help, maybe in a school facility, or maybe you've gone to the nearest counseling services available to you and you're seeking help. But then when you look at the environment, it does not feel safe. You feel like when you live there, everyone is going to be knowing your problems, probably where you're speaking from. There is no privacy, and maybe the next patient can hear what you have to say. And sometimes many people have been accused, especially those providing these services. Oh, you leave, maybe you've spoken to a patient and then you're going on to tell your friend, oh, so and so. So all of these things like safety, trustworthiness, collaboration are going to go a long way in ensuring that we see these positive changes in society. So this is one of the ways that people can improve. This is an area for improvement when it comes to this. So, and also it's important that healthcare practitioners are trained, goes beyond training to implementing the broad changes across organizations to address trauma. So a lot of healthcare practitioners are trained, but when it comes to implementation of the broader changes needed to see the change we need to see, a lot of it is neglected. So in as much as people may be getting these trainings day in day out, implementation also goes a long way. And this is one of the things that need to be upheld so that we can see positive change in these institutions, be it educational institutions, medical institutions, and what have you. So that is one of the things that I wanted to talk about. So on top of that, I think so I believe social policy should become more trauma informed so that it will be more participatory. So a lot of people get excluded when it comes to trauma work. So that needs to evolve to become participatory, transparent, collaborative, and also empower those taking part in it. So one of the ways that this change can manifest in society, especially for the youth, is trying to find the root causes of their trauma and other compounding factors. So there are youths, for instance, especially in slums, growing up, like here in Kenya, there is a slum where people grow up, they're exposed to so much, there is death everywhere, there is poor living standards and so much. I know these cases are replicable in even other states. But the thing is just identifying these things and maybe compounding factors that have happened throughout a youth's life can help identify effective ways to just tackle trauma for them, and also supporting change makers and communities these change makers serve can also be helpful in seeing the change that we want, and also recognizing that trauma is interconnected in the world that we live in. So what happened to, as we say, there's some forms of trauma I mentioned in the beginning of this, and one of them was the intergenerational, and even all of them that I mentioned. The thing is, we need to recognize that trauma is interconnected in this world. So what may have happened to our ancestors may still be lingering for us who are now presently here today. And part of making change is recognizing this, taking ownership for it, and taking positive steps to change. So those are just some of the few things that I wanted to bring to light. And also on top of that is just by viewing organizations as, always it's always about the bureaucracies, but now there is biocracies whereby organizations are deemed as living and learning systems. So under these biocracies, organizations are not viewed as static, but they are seen as dynamic. So they keep changing, they grow, they develop. And so when we view organizations, whatever organizations we are in, whether they are educational, whether they are healthcare, um, whether they're healthcare related or whether they are corporate, whether they are social work, when we view them as biocracies, only then can we provide nurturing health and vitality that is needed, rather than just being about productivity and financial performances. We can change these organizations to become more nurturing and just enable a safe place. So as I conclude, maybe I can just like discuss some of the statistics that I found interesting as I was looking into this. And some of them include so 80 there was a survey that was conducted about an year ago that found that at the workplace stress affects relationship. That people from the workplace took part in this survey, and 80% of them reported that stress affected their relationships with their friends, their family, and their coworkers. So 80% is such a large percentage for us to ignore. And I know this same this same scenario can be replicated in a lot of other organizations. So this is quite key to learn. And just part of trauma care work is identifying how severe these services how severely these services are needed, especially in organizations. And so, as we said, we're living in a world where there is so much. There is climate change. There is pandemics. There is forced displacement, and all of that. So, just recently, 67% reported that post COVID, people reported that they were 67% of people interviewed in a certain survey reported that their mental health status was not good, and 52% of them, that was post the number increased post the pandemic. So 52 of them before the pandemic were experiencing mental health issues. But then post the pandemic, this worsened. So this goes to tell us that the things that society is experiencing, especially now, like those I mentioned, increases the risk of people being stable mentally. And because of this, people have to seek help. They have to revolve and reform their organizations to be more healthy, um to just build a system whereby things work not only for the organizations but also for the people in them. So those are just some of the things that I wanted to discuss today. I'm happy that a lot of my colleagues and people who spoke before me highlighted these things. So thank you so much. I'll also encourage all of the people viewing this and present in this symposium today to take part in the trauma informed care course by Jazz, because it helps you in your workplace. It helps you as an individual. It helps you in every aspect of your life. So that can be one of the turning points for you if you want to get to learn more about what you can do. If you want to help yourself, this is a place to start. So thank you so much. And
Thank you. Thank you, Patience. We really appreciate you. Thank you so much. That was a wonderful presentation. I'm sure as people are listening to you, they are thinking of ways to apply some of the things they've heard in their various communities, industries, and countries. Thank you so much, Patience.
thank you.
So, moving on, we will be having the next session titled Adverse Childhood Experiences Sorry, just a minute. We'll be having the next session titled Adverse Childhood Experiences, African Cultural Practices, and the Psychological Effects on the African Youth. To take us through that is Sister Comfort Anum. Sister Comfort Anum is a member of the School Sisters of Notre Dame, a Catholic religious congregation. She holds a Bachelor of Arts in Early Childhood Education with a minor in psychology, as well as a Master of Science in Professional Counseling with a focus on school counseling. She's also a trained spiritual director, certified trauma coach, and certified family counselor. Sister Comfort has a diverse background in social work and education. She has worked as a social worker with prison inmates, a brief but impactful experience. She also spent time in Kenya working with orphans who lost their parents to HIV and AIDS, gaining valuable experience with young people across various age groups. Currently, Sister Comfort serves as a teacher and school counselor at an elementary school in Uyo, Akwa Ibom State. She also leads professional development workshops for teachers with her first-hand experience of the effects of trauma in schools. She advocates for the implementation of trauma-sensitive environments where teachers, pupils, and students can share their experiences in a supportive setting. I believe we have Sister Comfort with us already. Yeah, welcome, Sister Comfort. You have the floor. It's good to have you here.
Thank you, Esther. I'm glad to be here. It's like a lot has been said, and so many things that have been said have touched on some of the things I want to share with us today. They are not new. They are things we have heard before, but I just want to say more about it and say it's something that we need to keep on talking about because it's invading our society and it's affecting the children that we call the future of our nation. So I'm just going to go straight to my presentation, looking at time. As I said, adverse childhood experience, African cultural practices, and the psychological effect on the African youth. I like to say the African child because it begins from the early stage of development. So in my presentation today, I will highlight the activities that lead to trauma that we take for granted. It is also going to talk about the negative implication of cultural practices in the life of the individual. I will also share the impact of having trauma-informed schools because children, staff, and teachers are responsible for providing conducive environments for these children to thrive. Trauma occurs daily in our society, but we just do not give it a name. We either ignore it or try to normalize it. So when we talk about trauma in the African context, the natural thing to say would be, there's nothing like trauma. And what is happening to you is normal because others have had the same experience. We have a tendency to normalize things even when we know deep within that it is not okay. Let's just say, for example, the school where I work. I'm a school counselor and I stress on the effects of flogging the child. The teacher said to me, sister, these children have to be beaten to be able to respond well to what you're teaching them. They are stubborn and they need to be punished. We were beaten when we were growing up and we turned out well. This is what I struggle with because I don't think they turned out well. I see the same line of behavior with the teachers who say they turned out well. There are kids who have been beaten for so long such that at the sight of a cane, even if you are using it as a pointer, they are scared and even begin to panic or cry. What does that say to you as a teacher? They have had hard experiences that have psychologically affected them. Let us talk about adverse childhood experiences. Our experiences during our early years actually affect how we think, feel, and behave. Adverse and traumatic childhood experiences can halt development. Adverse childhood experiences are very common in our society. It could be in form of abuse, neglect, domestic violence, and difficulties stemming from mental illness and drug and alcohol abuse in the family. Adverse childhood experience is common in children from disadvantaged and under-resourced society. When this is not looked at into, it affects their behavior and their relationships in the future. I read a book on the conversation on trauma, resilience, and healing by Oprah and Dr. Bruce Perry, titled, What Happened to You? In that book, Oprah and Dr. Bruce stresses the effects of adverse childhood experiences on the development of the brain. The book focuses more on what trauma does in the brain of a developing child. It tells us that traumatic upbringing affects development. If we advocate for trauma-sensitive schools today, the future will be better for our children. Adverse childhood experience is not something to ignore because in my experience working with pupils, students, and teachers, I realized that many of them need help, but we sometimes see it as witchcraft or stubbornness, or we say it is normal. A trauma-informed school will give more attention to individuals with such experiences. Now let's talk about trauma-informed schools. Trauma-informed schools will help identify children who have had series of experiences that are affecting their ability to do well in school. It provides safe and conducive learning environment for the child to thrive. When a school is trauma-informed, the teachers pay more attention to the children that are placed in their care. Children feel supported and they feel safe to share their stories. In a trauma-informed school, teachers learn to ask the fundamental questions like, what happened to you versus what is wrong with you? According to Dr. Bruce, when we are able to ask the fundamental questions, then we focus on the problem and not the child. Both good or bad experiences help to shape who we become. I hear what is wrong with you all the time from teachers to students. That does not just focus on, School counselors will collaborate with teachers to promote a school that does not just focus on academics, but also on the other aspects of the child's life. If a child drops academically, a trauma-informed teacher should be able to ask the right questions to enable the child get all the help they need. When a teacher is trauma-informed, classroom management is not an issue because the classroom provides a safe and supportive environment for the child to thrive. In 2005, when I worked at a remand home, which later became the Juvenile Correctional Center in Akwa Ibom State, one of the things I saw that broke my heart was to see little children chased out of their homes, accused of witchcraft and murder. These little angels were beaten with canes and had wounds all over their bodies. I remember I was still a young nun in training to become a Catholic sister. My ministry was to wash the wounded bodies of these little ones. The question I remember asking myself was, what is left for this child? Thankfully, the government came to the rescue. They started something on protecting the lives of these children. This adverse childhood experience leads to other experiences that exposes the child to other risk. When they grow on the streets, they may encounter other forms of abuse that affect their development. And if these children are not helped, these experiences will follow them for the rest of their lives. Credit to the African Faith and Justice Network, who is working tirelessly to address the issue of child servitude and domestic violence. If they make it with much struggles, with all of these struggles, they may become teachers. They will also say, I was beaten and dragged to the streets, but I turned out well. They normalize it and think it is okay. We might forget about the experience, but the body keeps the score for us, as then the cock will put it. Something is going to touch that piece of you that was broken, and you will know if you turned out well or need healing. One of the things that Dr. Bruce said that I thought was of essence, especially to an African community that is more communal rather than individualistic. He said, true healing cannot take place in the absence of a community or in the absence of connection. The African believes in the Ubuntu principle that says that I am because we are, and since we are, therefore I am. This is an African worldview. What touches the individual gets to the community. Now I'm going to move into the cultural practices. There are cultural practices that have been on for so long, for so many years. Practices such as female genital mutilation, also known as FGM, child marriage, child servitude, breast ironing, also known as breast flattening, and many others. According to the United Nations statistics, breast ironing affects 3.8 million women around the world, and it is one of the 5 underreported crimes related to gender-based violence. I tend to believe that these practices are still carried out today in some cultures, even though the United Nations is trying to talk more and more about it. Female genital mutilation is a barbaric act. Children who go through this act are suffering today because of a cultural practice that is said to have positive impact. The people believe that when the clitoris is cut off, this will stop promiscuity, initiate girls to womanhood, and promote woman's chastity. This is not true. I would say this act rather leads to other problems like sexual addiction, where they begin to keep multiple partners in order to satisfy their sexual urge. This in itself is a big problem that we are facing today. These women have a poor image of themselves and feel they are not good enough. This is a violation of human rights and dignity. Here are some of the challenges and suggestions. We have insufficient experts to help support and treat those who are affected. We need to create avenues for people to be enlightened on the effects of adverse childhood experiences, which is some of the things I do in the schools that I go to. The school I visited last week, I have about 1,000 students, and out of 5 students that came to me individually, 3 of them were sexually abused at the age of 5. Some of them are in school, so they are free, but the moment they go back home, the perpetrator continues. So we need enough experts. Their schools have no counselors. They cannot afford to pay counselors. So there's nobody there. I listened to their stories and I left. So what next? Financial challenges. When you refer people, some of them say, I don't have the money to pay. No Afrocentric trauma system that will be relevant to African context. Yes, we have different therapies and all of that, But there are times that we need to bring something back to our own culture and see what helps. And Dr. Marino said something about it when she was talking this morning. We have things in our culture in Africa that can facilitate healing. Can we bring some of those Western cultures and see how we can integrate them into our culture and see how it fits our culture? Providing affordable more trauma care centers in different centers to help treat clients is very, very important. And I hear most of the speakers today talked about that. We need to create educational policies that will mandate all schools to have counselors, that will collaborate with teachers and parents to have trauma-informed schools and classrooms. When we talk about what the youth are facing today, and maybe what adults are facing today, it's beginning from that early childhood, because these things happened and nobody paid attention to it. And we have the tendency to deny. A mother denied that her husband was not abusing her child. She almost killed the child for coming to tell us that in school, but the child was suffering. So there's a tendency to deny. The federal government needs to make it mandatory that both federal government and state government schools to have trained professionals in schools so that the school children can have access to school counseling. Schools in Nigeria should redesign their classroom to adjust a trauma-informed classroom to achieve the desired result in education. Most children in our schools are passing through difficulties, and so they are re-traumatized each day, and they go unnoticed because schools are not trauma-informed. Trauma-informed counseling is of the utmost necessity in our schools today. So in summary, there's a mental health problem that can hinder an individual to achieve well-being and academic success. Today, only a few children are getting help from professionals because most of our schools lack counselors and are not trauma-informed. Counseling in school is an effective educational support program for children who are undergoing emotional health problems where it is available. This is not something that is prioritized in Nigeria. We are made to understand that adverse childhood experiences, be it good or bad, help to shape who we are in the future. When the normal development of the brain is derailed, it affects the brain development. We are also aware of the cultural practices that affect childhood development. These cultural practices should be challenged and brought to an end. We are all part of the whole. So what affects one person affects the whole. Let us remember the Ubuntu principle. I am because we are, and since we are, therefore I am. The individual person in the African context does not exist by themselves. They are part of a community. Let me conclude by saying that trauma is a public health issue and should be given priority. It is high time we wake up from our slumber and face this problem. Our experiences in our early years of growth and development affect how we think, feel, and behave. This can disrupt our growth. Adverse childhood experiences are common in our society. It comes in various forms such as abuse, neglect, domestic violence, and other struggles coming from mental illness. Let us reevaluate our cultural practices and give our children a better future and provide for them an environment that is free from all forms of abuse that will derail development. If we collaborate with the right channels to put in place trauma-informed care system in schools and the society at large, and fill those loopholes where the government have failed, then our children will be safe from any persecution or any form of abuse. We can see that trauma-informed counseling is a sine qua non. It is a necessity in the education system. Professionals should begin to ask the fundamental questions. As Dr. Bruce will say, what happened to you versus what is wrong with you? Knowing that it is a step to healing. Adverse childhood experiences leave lasting impact on us and influences who we become. Thank you.
Thank you so very much, Sister Comfort. for those important insights and reminders. That's been so enlightening. Thank you so much. We are really getting it a lot from our rich speakers today. This has been good. If you feel it, I need you to type good, 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 good in the chat section. If you can hear me, just type good. I mean, say anything that lets us know the vibe in your room right now. Send anything to the chat box that lets us know how you are feeling. I'm feeling really good with so much that I've learned today. And it's raining here, so it makes it all good. Yes, thank you. Thank you so much. Now, right now, we will be having a youth focused session. And if you're current, you know that the youth are changing the world. For this session, we have Patience Injury, Comfort Anum, Elizabeth Lawrence, and Esther Olayinka Bello. They'll be talking about trauma, ACEs, and youth in Africa. And this will be moderated by none other but Professor Merino. So I'm going to hand over to Deb right now, if they can hear me.
Yes, ma'am, we can hear you. You're muted.
I'm handing over to you. Okay.
You're muted, ma'am. We can't hear you. Hello? No, is this my network over there? Hello, Malaya, can you hear me? Oh, wow. Okay, what's going on? Hello? Okay, I think we're having a bit of a network challenge. Okay, I'm bringing back Sister Comfort. Dr. Marino is supposed to chair this session, but I think she's having some network issues. Okay. Okay, I think I see Elizabeth Lawrence as well. Okay. Hi, Elizabeth.
Hi, Esther. How are you? I
I'm
hope you're
very
having a
well,
good
thank
day.
you.
Yeah,
Yes, I am. And you?
I am.
Hello,
Yeah.
can you guys hear me?
Yeah, yes,
Yes,
we
we
can
can.
now.
They can't hear me.
We
We
can
can
hear
hear you, Mom.
you.
Okay. All right. So the network is not good where I am. Obviously, you can tell that I'm in Lagos. So um, and so it is important that we round this up with this panel because we want to round it up with what you guys are really passionate about. We want to talk about the youth. We want to talk about piggyback on what Patient already started talking about. And Sister Comfort already also had that conversation. When you come to most of Africa, it's predominantly a very young continent. Uh, I mean, over 65% are 30 years old and less here in Nigeria. And so when we're looking at these huge statistics, we that is block, right? You guys can move and it can move the country. So let's have can you hear me now?
Yes,
Yes.
ma'am.
Can you
Yes,
hear
we
me?
can.
Can.
Yes,
Yes.
ma'am.
Can you?
Yes, we can hear you.
All right. If you can hear me, just say something. Don't. If you
We
can
can
hear
hear
me,
you, ma'am.
unmute yourself and
We
say you
can
can
hear
hear
We
you.
are
me.
Can hear you.
responding. We are responding. We can hear you.
Okay. So yes. So let me know because I am dealing with a very unstable network. So if I go away, you guys keep talking. You have only 10 minutes. Actually, right now we have 8 minutes. So I want to go through every one of you, starting with Esther. Well, give us some of your thoughts about the barriers to youth wellness and what we can do about it. We'll start with Esther, and then we just go clockwise. All right, let's go.
Okay.
Esther, is
Um,
Esther there?
yeah, we heard you. Okay, so
Okay.
for me, I'll just say that being a youth in Nigeria, one major barrier, I'll just speak for myself, one major barrier is the fact that we were raised in a way that we had to be by ourselves in quotes, and then now we are trying to reconnect with the fast-paced society, and sometimes that can be a difficulty in terms of things are constantly changing for you, and you are trying to grapple with um, the new trends that are happening, even though the young people now are people who are good with trends, but sometimes because of that speed to move, it can also make you feel overwhelmed sometimes, and that can affect your productivity overall. But generally, if we look at the economy as well, today there's so much uncertainty in Nigeria as a country, especially. That uncertainty can also upset you. Make plans, okay, I want to do this, and you're ready to go, but then something happens. One is this network that we are struggling with right now. You have things to do, but then challenges like this come your way, and it's affecting your mental and emotional state, such that you become less productive than you actually want to be. That can affect, and that is a cycle, because then you are feeling overwhelmed, and so you are slow to be productive as well. So you are feeling overwhelmed that you're not productive, but then you can't also be productive. That can also, or that is also a major issue I think a lot of youth are battling
Network
with
is not
right
good
now.
right now.
I'll stop there so that my other colleagues can contribute. Yeah, maybe Elizabeth or Comfort can go next.
Okay,
Okay,
okay.
I just want,
Esther,
Okay.
I don't think your network is not good either because we're just hearing. At least I'm just hearing every other word you're saying. Is it my network?
Yes, ma'am.
Is it just
Yeah,
me that's just hearing every other word?
I think it's
Yeah,
yours,
they
ma'am.
heard
Oh,
me. I think it's your
okay.
network.
Continue
Yes.
that.
Okay, okay, I'll go next. So I think for me, number one is stigma. There's a lot of stigma around mental health issues, and it's making the youth very reluctant to seek help due to the fear of judgment. And another one, I think to an extent, I think we've done a little work around awareness, but I think we need to do more. I was excited this year to see that a lot of organizations, a lot of schools took mental health awareness seriously. And it was exciting because compared to last year it was like nothing was happening. But this year, I know I was invited to at least 5 events that had to do with mental health. And one other one again, I think is financial constraints. I think of course, because to get mental health services or help, it's quite expensive, except if you can find organizations that are able to do or give you those services free. And even if they can, they usually would just maybe offer you maybe the first aid, the psychological first aid, which might not be sufficient for you. And the last one, I think, is lack of parental or guardian support. I think they create this barrier for youth when they don't support them to find help when they need help. Yeah.
Okay, I'm just
What
going
do
to
you
build on.
think? Hold on, you're not you all answered Esther's question.
Oh,
The
okay.
question I was going to ask Elizabeth. Everybody gets their own question. The
Okay,
question I was
ma'am.
going to ask Elizabeth is that because you are in the north, right?
Yes, ma'am.
Are there any you know challenges or adversities that you think are common or unique to the northern youth and children than in the other parts of the country?
Okay. While Dr. The doctor from KADBUSA was speaking, she mentioned something about um, she used the house word, but she said something about shyness. There's this shame around mental health, and I would relate it still to stigma. People don't believe that mental health issues is like a mental health disorder. Like for the
Mhm.
North, when you have mental health issues, most times they view it as something spiritual. And in Hausa, there's something most times they like to use. They will say it's kokai. They call it iskokai, and they tend to, instead of them taking you to the hospital for help, they shift you towards maybe the church or towards the imams for prayers, and you end up being locked up and you don't get help at the end of the day. Yeah, and I think one other barrier could be in the north we tend to, there's this thing about you have to get permission from, let's say you're the wife, you have to get permission from your husband before you can like do anything. It's so bad that when you go to the hospital, even if your life, you're going to have a child and you're about to die, they would want, the doctor would be telling, the husband would be telling the doctor that he doesn't want a male doctor, he wants a female doctor to, like, take care of his wife and all of that. So I think basically those are the two. And again, I think for the north too, the environment is very toxic. We're just there's just so much kidnapping, banditry, and all of that, and we're all um, everybody's just in a state of fear all the time. And I think most times it limits people from going out to get help.
Yeah, because the kidnapping is big, right? The kidnapping is big,
Yeah.
and it's very rampant, and it destabilizes communities, not just families, but communities, and sometimes the entire
Yeah.
state. So that's those are significant. Senior Comfort, where you're from? You work in Akwa Ibom?
Yes, Akwa Ibom.
Okay, so what are some of the peculiarities in that state when it comes to the young people?
Well, what I see here most of the time, I see the youth feel that they are not heard. And whenever there's anything negative, they go back to the youth. So, because of that, there's a lot of anger around young people saying nobody cares about them, nobody listens to them. Rather, there's always negative things attached to them. When it comes to doing of drugs, they say young people. When it comes to stealing, they say young people. So even those who are not part of this, nobody is listening that something is happening or something is not going well, but they are pointing fingers at them. And because of this, they don't respond well to the society. They fight back. They are fighting back. When you travel
Mm.
in the east, through the east, the police will stop you on the road and just point at the young people. You, come out of the car, bring your bag, let's check you. They begin to search their pockets, pull their clothes. This is a sad thing that goes on every day on our roads. And the youth are saying, why does this happen here? I don't see that in the north, but I see that mostly here. And sometimes they will tell the driver, move, we are going to deal with him. And sometimes they collect huge sum of money from them. So even how to dress now,
Wow.
the youth are struggling. If you have dreadlocks, it makes it worse because it's a bad connotation to wear dreadlocks and traveling on the road. They point you, they call it Yahoo boys. There's this something of Yahoo going on right now. So even if you are not, so you have to mind how you dress because they just attack them and begin to check them. So this is really something that is affecting the youth in this part of the world today.
Wow. That's like stereotyping, backlisting, is a whole bunch of stuff that's happening here. So you guys have presented, you know, different challenges in your own part of the country. I just happen to be talking to Nigerians here. We have people who represent from Kenya. We have people who represent from other countries. However, what give us everybody, each one of you, can you provide two solutions that you can we can end with and say these are the solutions where we are offering. These are the things that needs to happen in order for us to be able to have a system of wellness in my state or in my community. Who wants to go first? Esther, since you started.
Yeah, can you hear me now?
Yeah.
Okay. So I think the first thing I would say is training and awareness. I feel like those are things that are highly underrated. Elizabeth had mentioned it earlier. We think we are doing awareness, but we're not doing enough yet. People need to be informed and aware about this, the impact of trauma, how they can heal, how they can help those around them to deal with all of the internal struggles, and then they are able to function to help other people. So information, training, and awareness. Excuse me. That is one thing I would say that we need to do more of. So I'll just stay there and let others share other things.
Okay. For me, I
Absolutely.
think,
Training. We need to train.
yeah.
Go ahead.
And the training is not only for like mental health professionals. They need to be trained also on youth friendly services, because I work in the HIV area, and I know one of the things that was a major breakthrough for us was that we had to introduce youth friendly services. So you find out that we have some locations where it's youth friendly specific. So you go there and you find out that most of the youth are attracted or drawn to those locations. So I think we should train more professionals. We need more like non-technical professionals to be able to offer these services, and it should be youth friendly. And again, I think I would say again, parental involvement. I think family support is a big thing. If the family is involved in your mental health or your healing journey, I think it goes a long way.
Absolutely.
Mm,
Absolutely.
Yeah.
Thank you. Sister Comfort.
yeah, I just want to agree with all they have shared. One of my points was on that piece of the family unit. I think the family has a big role to play in this because family is a special, that's where the child begins from.
Yeah.
So the family has to, I don't know whether it goes back, we have to also bring this to family to sensitize them on their roles as parents. What is the upbringing? What environment is your child growing into? What environment do you provide for them? So parents need to also participate in helping the youth. And one other thing is finding ways, informing youth of helping them find ways to channel their anger, maybe to the government or to the right people, because most of the times they rebel and they use the wrong approach. So sensitizing them on how they can talk to the government or the appropriate channels to help them, to listen to them so that they feel heard. This is also something that's going to help them. I believe that when they are heard, they will act more appropriately than just saying, oh, they are youths, they're just being youths. That adds more fuel to the fire.
Absolutely. Thank you, everyone, from training to that they should be heard, from all of these approaches, reducing stigma, all of these things that you guys have talked about here. They're very important. And I want to thank you for spending this short time with me. And hopefully we'll see you tomorrow. But not hopefully, I'm hopeful. I will see you tomorrow. All right.
Sure.
So talk to you.
Sure, ma'am.
Bye-bye.
Thank you, ma'am.
Thank you.
Thank you, ma'am. For the closing remarks, we would have.
I will give the closing remarks because Ms. Beans
Okay,
cannot
okay, ma'am.
come
Okay,
from
ma'am.
network.
Okay, ma'am.
All right. Thank you, everyone. This has been a wonderful time. I would like to say a big thank you and appreciation to all of the luminaries that were here today. Every one of you who spoke so eloquently, you presented your own abstracts, you presented your own speaking points, and you were able to change lives today. I know it's been a long day. We want to say thank you for being a part of this journey with African Trauma Care Alliance and JARS Therapeutic Institute. We want to say that we hope you join us again tomorrow. Tomorrow is the second day, and tomorrow we have a huge lineup for you of speakers who are going to be here facilitating, presenting, and changing lives again. So let me see if I can pull up the speakers for tomorrow so I can just show you. Somebody can help me with that if they have it, please. The speakers for tomorrow. I mean, on top of my head, I know that Dr. Mrs. Yinka Gunde is going to be here tomorrow. I know Ganiyat is going to be here tomorrow. I know that do we have the list
We're
of the
having a
speakers for
special
tomorrow?
presentation tomorrow of the KADBUSA trauma approach.
Okay, I'm going to be speaking on the KADBUSA tomorrow, so you don't want to miss that. It's a brand spanking new trauma module that I'm going to unveil to the world tomorrow. My students are already learning this, and they're so excited about it, and so we'll present it tomorrow. Dr. Samba is going to be here. I've already said about Ganiat. Stella is going to be with us. Stephen from Kenya is going to be with us. Apostle Jegede is going to be here. That's going to be mighty. Who else? Mrs. Ying. Oh, the Commissioner for Health for Kaduna is going to be here. We just have a slew of speakers for you tomorrow. Please make sure you tune in, and remember, this is a scholarly setting. We're discussing trends, we're discussing challenges and how we can address them as a continent. So thank you for being with us, and we'll see you we'll see you tomorrow. I would also like to thank the MCs, Omolayo and Esther. Thank you for taking the helm on this, and you guys did a fantastic job. Let's clap for them. Well done. For all my behind the scenes people, the director Bingpe Oshinoga, thank you. For Busayo, thank you. For my IT team, thank you. For IT, Ken and Olayemi, and for social media, with Olawale, thank you so much. We'll see you guys tomorrow. Have a blessed day.